Stay here on my eyes. All right, Pete, you ready over there?
Anytime.
All right. All right. Ready to kick off there, Gus?
Yeah.
Okay. All right. So we're 15 minutes late here. Sorry about that. All right. So welcome to the Medfield Select Board meeting for Tuesday, October 15th. This meeting will be held in hybrid format. The Select Board is here in person. Members of the public may attend in person. In addition, members of the public who wish to participate via Zoom may do so. They can go to the town website, go to the calendar. You'll see the link for tonight's meeting. If you don't have access to a computer, there is a dial-in number. And then importantly, there is a packet that you can click on the link and look at all the information we're about to discuss here this evening. And it is being recorded, so you can watch it later on if you're bored tonight or any other point, whether it be on Medfield TV or YouTube. Mike's got us under control back there. We've already done our open meeting, so let's jump to call to order. Before I get underway, though, I do want to take a moment of appreciation for our troops serving around the globe in defense of our country. Thank you. All right, kick things off for appointments. We've got Rick Fink request to use Warrior Park for the day before Thanksgiving. Hey, Rick.
Hello, everybody. How are you? Good. So we did this 2 years ago. So it got everything started with the park's name and all that. I think some tradition wouldn't be a bad thing. So I would propose seeing how this goes again. I think we had a successful event last time. So it's the 27th of November, just from like 10 to 2 is what we're requesting. Funding we'll take care of that. Board of Health, I know the protocols are there, so we'll just fine tune that. And I have a email out to the police chief for one patrol officer like we did last time. I do know the librarians were overwhelmed, so that's something that perhaps we could help with. I don't know how we do that. It wasn't our kids, to be clear, this event is ideally set up for the elementary kids at Dale and Wheelock, but the kids from the middle school, those were the ones. So, we create this environment and some excitement. If there's anything we could do to help with that, but I have no ideas. But that was the only thing I would change.
Okay. So we did get a letter from the person at the library that was, they got wind that you were on the agenda tonight. All they did was express to us their concern, and you just hit upon it, that they were overwhelmed with kids, that there was destruction and disruption. And the request was, if this is going to go forward, they think part of the concern may have been adult supervision. There just weren't enough adults to manage the success that you face, which is a blessing and a curse, right? You could have had 15 little kids show up and you would have had it managed, but instead it was just the opposite. You had more than you anticipated, which is a token to the intent of what you're trying to do. So I think the question would be is what would you do differently this year than last time to make sure that there are enough adults there to help kind of control the crowd? You can't control every kid, but at least show the library.
I can.
Yeah. Well, at least you can show the library that we can go back to them and say, these are the things that Rick's going to do differently, understanding that there was.
Yeah, there's definitely volunteer support out there, right? So I think 8 high school students got 4 hours of volunteer time with us last time, and I don't think that's including the high school jazz band that we had entertained. So yeah, I mean, I would double it. I would say, hey, how many do we need? And then we would have like an adult per, I don't know, a 1-to-3 ratio with adult to a little security team to. But then again, those aren't our kids, So I don't know what jurisdiction we would have to tell a kid from Blake that he can't go into the school. I mean, into the library? I don't, or do we tell them to disperse? Do we get squirt guns? I mean, I don't know what to.
How big was the crowd last, if this,
We gave away 500 slices of pizza, so let's assume
250 to,
yeah, like 9 kids were there. Yeah, I don't know. It was
okay.
very well attended, and that sustained. And then parents actually started coming early to pick up the kids, and then there was some hang time there, which was great. So it kind of had a steady flow, and then it just, you know, it's funny, when the pizza was gone, so were the people. So we can kind of pull the plug there.
Okay. Pete, do you have any?
It's just that supervision thing that was brought to our attention. I think that needs to get solved, Rick.
Well, the library that had this concern, are they here tonight to offer a solution? Because I'm happy to work with them. My solution, or my offering, would be to get little security teams, but we need instruction. I mean, I can't just tell high school kids and adult volunteers to go chase after the hoodlum with the backpack or whatever, right?
Do you, okay. So, I mean, I think it's an important building, right? So like we can kind of somewhat like laugh it off, but it's our library. So
Right.
if they're in there and they don't want destruction, they don't want anyone being disruptive. I think the coaching is certainly sit down and if I can sit in on the meeting if need be, to be like, okay, I think what you're trying to do is fantastic, but the kids going and the adults going, there's got to be a common understanding of the doors to the library are not open so everyone can run in and run out, right? That
Yeah. Well, how about this? We start with communication. So we would reach out to the principals,
Yep.
make an announcement, say the expectation is there will be no shenanigans going on at the library. You go there, you study or whatever you need to do, but it's not a place of recreation. That we could take notes. You know, like, who are these people? I don't know. Again, I don't feel like calling out kids and reporting them to the principal, but
Let me let's back up here.
Yep.
So you had 200, I don't know, say you had 250 kids there last time.
Sure.
I just didn't appreciate the disruption. The reason it was that big a crowd was because students from Blake showed up and joined the festivities.
no, everything was, it wasn't really age appropriate for them. If they came, they soon left. There was really nothing there for them.
Okay. Well, so where my head is going, to the extent that there were Blake students that really weren't supposed to be there that showed up that added or introduced mayhem, as opposed to Blake students who were simply trying to go to the library if it's possible to make that distinction. If this was announced as, you know, an elementary school event, and if the Blake administration was asked to listen, please announce to your students there's another event like we had a couple of years ago at the library to commemorate the Warrior Park and to, you know, just gather before Thanksgiving, but it's intended for elementary school kids.
Yeah.
Last time around, there was confusion. We want to ask all of you students not, you know, if you do go to the library, that's fine, go in the library, but do not join in or otherwise interfere with the elementary school celebration that's going on outside there.
Sure.
And it seems to me the first thing you want to do is divert any kids from Blake that were contributing to anything that wasn't supposed to happen there. At least have the administration ask them to not just get involved in it, rather than simply find out how many more volunteers do we have or do we need to handle uninvited Blake students.
Yeah, I feel like the two modes of communication would be a morning announcement and then like the weekly principal's blog.
and I think
Anything else that you can think of, I would add.
we just got a valid question for someone that's remote saying, could you just take a step back for those of us that don't even know what Rick did 2 years ago, what this is? So a refresher is 2 years ago, you thought of kicking off a tradition of it's a half day, kids are out of school, parents are running around town getting errands done, give them a place to go. You had face painting, if I'm not mistaken, you had various things going on, as well as free pizza. So it was just something you thought would be a nice community event, right?
Yep.
And you didn't get a chance to do it last year. You're back to do it this year. You've got the same, if not more, adult supervision helping you with different festivities. Will you be communicating this in any other way other than just to the 2 schools to have it announced?
I would, let's see, I write a press release like I did that went out, I think, a week before the event.
Okay.
Posted that to the patch. That inevitably gets posted to the social media
Yeah.
sites in town. And then the Hometown Weekly will get it.
And I can just say coaching, and you just said it yourself with communication. I would just denote, like, it's a fun event, be respectful of the
Yeah.
property that we're around. Warrior Park sits between a retail establishment and the town library. And it's a beautiful piece of property. And as young kids, it was a civic exercise to be involved with the election. It's a civic exercise to be respectful to people and property.
I will write up these communications and have you guys sign off on them and then send them to the principals.
You good with
I'll,
that?
I'll write the release. I'll give it to the media.
Okay. You good with that?
And
Sure.
you're gonna make sure you have more supervision than you did last year?
I will have a list of volunteers, and I'll reach out to, I guess, the National Honor Society, maybe some youth groups. I'm open. I mean, it's not like I have, the master plan here of like how we're going to do everything. You could just simply say, hey, check these people out. Or I know some kids that need some community service. I'd be happy to add them to the list because I'm thinking maybe 20 or 30. I mean, if we just had around, the whole.
Yeah, if Lake students are the concern, I would think having high school students as your, not that you wouldn't have any adults, so you're talking about certain ratio of adults to the high school students, but I would think having more high school students if you can get them. I don't know, when I was in middle school, if high school students were running the show, I wasn't going to go take them on. So if there's an issue, I'm guessing that hasn't changed too much since, but they might almost have more credibility with the middle school because of the high school. You're not.
I hear you. Yep.
Yeah.
I'll ask the Medfield O line.
Huh.
The whole
Yeah.
the whole
And again,
football team could just go around the whole thing. I mean, whoever wants to do this, whoever needs. Hey, are you a high school kid? You need 4 hours of community service? Look me up.
Well, and the
We'll get
message
going,
is, right, to
you
be
know?
respectful to the library.
Yep.
The message is, we can chuckle, but at the end of the day, we want this to be a tradition. We don't, and the message to the principals is, make sure they understand that this tradition can start and continue. It's going to be the actions of the youth that are going to let this happen or not. Not that the adults don't want it to happen, but it's their own actions that are going to make this. It's like all night grad. That's what going on their 30th, 40th year. It's obviously worked out very well
Sure.
with the right support and the right communications. It's a nice event every year at the end of graduation.
Well, I could put out a communication just inviting people, just a good explainer of what would be involved. You could do 2-hour shifts, 4-hour shifts, whatever.
Okay. We're good?
I think it's just a question of somehow making sure that the people show up and help to supervise, Rick, however you do that, but that's the important thing. I mean, I think what you want to do is just build on what you did last year, and apparently more supervision is needed, so just,
Yeah, that won't be a problem because everyone that did it before wants to help again.
Good.
And then parents that I was conversing with that were hanging out, they were interested in getting involved. Some people even gave money. So,
Good.
good.
And you are open to donations. Let's make sure that.
yeah, you can always give us money for the pizzas too. So, but more on that, like we spent like $800. I think $1,000, who knows what we'll offer, more pizza, more decorations, balloons. I don't know.
Okay.
It's just something to do.
Okay.
Thanks, Rick.
Thank you.
Perfect. Thank you.
Bye.
All right, next up, Chief Michelle Garrett requests the select board vote to appoint David Hayes as a full-time officer of the Medfield Police Department effective October 17th, 2024. But I think I see Barry sneaking in. Good evening.
Members of the board, I'm here representing Chief Corrett. Humbly requesting that we appoint David Hayes, who is currently a recruit officer at the Holyoke Police Academy, to the status of a full-time officer, effective October 17th.
Okay. Any more background you want to share? Are we good?
That's my
Okay.
request, yeah.
Pete, any questions?
No?
Only question I had was the scorecard. No. It ought to be, I hope it's an easy.
Oh,
It was just only because we've had a number of requests for appointments of officers, which are fine to do. I'm fine with this. But I'm sitting there saying, at what point is the bucket full? We got to be getting close, right?
we're at 19 total, including myself and the chief.
Okay, counting this.
Yes.
in there. So that means,
17 sergeants and patrolmen.
I don't object to having more coming in. It's just-
I know you don't.
It's just I was thinking, boy, we've been appointing a lot of officers. We haven't been losing any as far as I know, but okay, so
good.
this'll do.
Full staffing, yeah.
Full staff.
No, I'm thrilled. I'm
Yeah.
thrilled that you guys are got more officers now, and it takes away all the rhetoric from 2 years ago where everyone was complaining about overtime and not having enough. I think that is the rear review mirror.
Yeah, we're doing good.
All right, so.
Yep,
yes.
I move that we appoint David Hayes as a full-time officer of the Medfield Police Department effective October 17th, 2024.
Second?
All those in favor?
Aye, aye.
Thank you so much.
Great, thank you. All right. Next up, we have Mr. William Carrico, Fire Chief, to discuss the staffing for adequate fire and emergency response, as you may hear us refer to as SAFER, grant awarded to the town for increasing staffing for the Medfield Fire Department. Hey,
How you
Chief.
guys doing?
Well, how are you doing?
Doing all right. As you know, we did get the SAFER grant. On September 23rd, we were awarded $1,138,176 to hire 4 firefighters for 3 years. We are one of 9 Massachusetts communities to receive this grant and one of 174 nationwide. This grant is a very competitive process in which we had to answer 19 essay questions, which centered on the department's current ability to meet national standards, specifically NFPA, OSHA, staffing requirements for responding to initial emergency scene operations and how added staffing would enhance compliance with those standards. The award is broken down over 3 years, and we are not allowed to exceed the federal funds awarded each year. The total award covers base salaries and OPEB costs for the 3 years. The breakdown is as follows. Year 1, $362,104. Year 2, $379,808. Year 3, $369,264. Any unused funds are pushed forward and allowed to be used at the end of the grant. The grant does not include clothing, equipment, and overtime, so vacation time, personal time, that is not covered. At the end of the grant period, the award does not include a stipulation that the awarding agency has to retain the firefighters. You can keep them or let them go. All federal grants contain articles with the awards. The 48 articles included with this grant are boilerplate language included with every grant award. The primary purpose of the grant is to provide minimum staffing to quickly get to the scene of a fire with 4 firefighters and start fireground operations while meeting compliance with the 2-in, 2-out rule. These requirements are NFPA 1710, which requires the turnout time of 80 seconds and an on-scene time of 4 minutes. We currently do not meet this standard with four people. OSHA 29 CFR 1910-134, the 2-in, 2-out rule, is a safety requirement for firefighters that requires at least 2 firefighters to remain outside a burning structure while 2 other fight the fire inside. With our current response model, we are waiting for members to respond to meet this requirement, which delays response and fire attack. For every minute a fire burns, it doubles in size. Both the NFPA and OSHA requirements ensure that firefighters are ready to respond to a mayday situation, which typically happens in the first 10 minutes of a fire. A mayday is a trapped or injured firefighter. They're calling for help. We need to be in compliance with these standards. The second benefit of this grant enables the department to hire 4 paramedics to staff 2 ALS ambulances if needed. This will bring our staffing levels up to 4 members on the 4 shifts. As EMS now makes up 60% of what we do, it will lessen our dependency on mutual aid units and provide proper coverage when the first ambulance is committed. The department currently operates with 3 full-time firefighter EMTs, medics on the 4 groups. There are 13 on-call firefighters which are called back using the box alarm system, which is activated when the scope of potential incident dictates the need for additional responders. Examples of these incidents would be medicals, second medicals, fires, fire alarms, motor vehicle extrications, etc. NFPA standards dictate minimum acceptable response times for response to fires and medicals. OSHA standards specify minimum operation manning requirements for interior firefighting to begin. I must emphasize the call system is required and will be maintained. It is an essential component to this response model. We currently rely on-call firefighter EMTs to staff the second ambulance when we face multiple calls. There are no paramedics on the on-call staff, and the availability of EMTs willing to participate in the ambulance is limited. We do, however, have 2 on-call members going to paramedic school. Each time I've spoken before you, I've noted the response statistics of the membership. These statistics were noted in the grant narrative. I have spoken of lost revenue due to not having enough paramedics. OEMS protocols dictate high acuity calls require the response of 2 paramedics. High acuity calls are cardiac arrest, seizures, strokes, traumas. These type of calls happen when the first ambulance is on the call. We rely on our mutual aid ALS providers to assist us to provide ALS service. Revenue is then lost to those communities. The cost impact. As salaries are the only cost covered in the grant, I estimate the impact to the department budget will be as follows. Fiscal year 25, $43,169. Fiscal year 26, $54,575. Fiscal year 27, $53,038. Fiscal year 28, $22,993. It's a total cost of $173,777 in the 36 months. As Gus will probably ask me about EMS revenue, forecasting ambulance revenue can be challenging as billing is based on the level of care and the insurance coverage affected the final payment. Since fiscal year 21, the ambulance has generated $1.8 million in revenue. This year to date, we are at $138,839. And I anticipate that number will be close to $555,000 by the end of the fiscal year. This far exceeds the $150,000 the ALS committee quoted. And I must note that we are currently 100 EMS calls ahead of last year. With the SAFER grant and the 4 additional firefighter medics, I anticipate an additional increase of up to $134,000, as we typically have an average of 60-second medical mutual aid ambulances coming into Medfield. I'm open to your questions.
So, did I hear you say that your response time to a fire is supposed to be 4 minutes?
Yeah, the NFPA 1710, they want us to be on scene within 4 minutes. So you have 80 seconds from the time that dispatch tells us what's happening. You have 80 seconds to get to the truck, and then you're supposed to be on scene within 4 minutes.
And did I also hear you say that the fire doubles every minute,
Correct.
which is why you want to get there fast?
I want to get
yeah.
there as fast as we can. Now,
Okay.
the call force does a great job. You know, they're responding from home. They come into the station, but we need to get there as fast as possible.
Yeah.
And you know, is it a need and a want? Well, it's both. I want to hit these standards because we need to.
That doubling every minute in size is
It's significant.
oh yeah, that's huge. And so I wasn't sure that I followed all the figures you were giving us on the income. And that was something that jumped at me when I saw the grant. Congratulations, by the way. Thank you for getting it, and congratulations on getting it. And so what my concern goes to is after the 3 years, and all of a sudden we've got another 400,000 on the town budget of cost. How much income are we going to offset that with, Chief? I wasn't quite sure that
Well, it's once again, I can't predict medicals that are coming in, and it looks like we could go up 10% every year with our revenues, but I can't guarantee what we're going to have for an increase in calls. So predicting what's going to be happening 4 years from now, it's rather tough. We're averaging about 1,400 calls a year. It goes up or down. With the trend of EMS increasing every year, I can only think that it's going to go up some more.
So how many calls a year are we giving over to other towns through mutual aid?
It's about 60 calls that
Per year?
we're bringing in people to cover our calls
Per year?
per year.
Yeah, so that's not too many then. Maybe 5 a month or something, okay. That doesn't sound like a lot of extra revenue, an extra 5.
Well, it all depends on the service that was provided. And one of the things that we haven't done is we haven't looked at our rates since I've been here. I want to say I've never come before you and asked for a rate increase that I recall. And that could be something that we could also look at, because obviously, as you know, everything's going up, including medical expenses. And we used to be kind of at the middle to top of the pack with ambulance billing, and I think we're now kind of in the bottom middle. So if that's something that you want to address in the future, we can certainly look at it. And you have to remember that when you're doing ambulance calls, it's also dependent on the insurance that people have. So if you're doing a lot of Medicare transports, it doesn't matter if you're billing $2,200, Medicare is only going to pay you $500. But if you have a lot of people with really great insurance, and then that's where you get the return.
So we need some sort of, when they dial 911, we'll figure out their insurance at the top, and
Well, yeah,
we'll
ultimately,
prioritize you.
yeah, my whole thing is when it comes down to that, I just want to get the people to the hospital, and we want to render care.
Absolutely, yeah, yeah. Excuse me. And I think I mean, what everybody wants is to see a paramedic show up when they have a family emergency. And so that I think this is a service that the town residents really like and want. So that this is very appealing to add this to our department. So
I'd just give you one more example. A couple of weeks back, we had a motor vehicle versus a bike on Granite Street. We had to call Millis for a second paramedic because we didn't have the medics working. So in those instances, obviously we're trying to grab from other communities, and with the Norfolk County mutual aid agreement, as far as billing goes, I'm on the hook for paying them 50% of the medical for the call. So every time that we have these people come in, we start losing revenue. And there's another side of this, is that we're being used by other communities more than we ever have in the past. So we're receiving mutual aid less than we're giving it. So, because we're always going to Dover, we're going to Millis. Westwood has our ambulance on their working fire assignment. So when they have a fire, they require an ALS ambulance. So we provide the ambulance there. So they could be over in Westwood for 2 or 3 hours, and then we have no ALS coverage in town.
So at this point, you can put out a second ambulance, but it's not with people that are in the firehouse.
It's only with EMT. So we have the shift commander who would be working. He would go to the scene. Right now, in our current situation, we would put a box alarm to get the ambulance to the scene. If it turns out that it's going to be an ALS call, cardiac or a seizure stroke or one of those, then typically we're going to call the mutual aid ambulance, and we're going to let them take the call.
Yep. Well, again, congratulations on getting it.
Thank you. So as far as the grant, we have until October 23rd to accept it. So for the Board of Selectmen, I need to know, do you want the grant or you do not want the grant?
Okay.
Are you all set?
I am. I'd very much like to hear from I see that Steve Callahan's here. I'd love to hear from Steve about the financial ramifications if the warrant committee has considered it, Steve.
Yeah. So I'm going to have Gus ask some questions because that may help Steve when he gives more answers.
First, Chief, thanks for anticipating that I would have financial questions. And not only that, but you anticipated the questions I would have. You actually answered it first. I said, yeah, but he's not addressing what the added revenue would be from this. And then I think if I heard you right, it's as an estimate, 134,000,
Yep.
I'm assuming a year.
Yep.
And you said the added cost to the town was, I simplify things, about 50,000 a year. So
Roughly,
I'm
yes.
kind of saying, so in this thing that we're looking at, we might be picking up $50,000 in cost. We anticipate we would be picking up 134,000 in revenue. So,
Correct.
For those who haven't been following this closely over the years, when we first went to ALS, I think the committee and Chief Carrico all used conservative projections for what the revenues would be. And I still remember in that first year, the ramp that you had and the revenue flow was well above what the projections were. So I have not forgotten that from 7 years ago or something like that.
You got to remember, I came in right at the end of that. So I started, my first town meeting was the ALS committee meeting.
Well, I'm pretty sure you were here when
Still
the, when the,
recovering.
when the, when the, when the funds rolled in. So that's, so thank you for anticipating, but also I just want to acknowledge, I've been following this all along, and it seems to me with our ALS program, at the very least, whatever incremental costs we might think are being added in when we've expanded it or when we've moved toward it, we've underestimated the revenues that go along with it, and so the actual impact on the town has, I think, generally been positive. Even it's not even a small negative; it's been positive, and it sounds like that, at least with what we know right now, during the Safer Grant period, would hold true. And I think Pete also asked a question that I had, is I'm assuming that if we had 2 ALS ambulances, then a lot of that swapping out would go on. And then you also pointed out that on top of that, we might be more prepared to actually lend support. So
Correct.
that doesn't sound like a bad thing. I know I sound like the financial curmudgeon, but aside from that, I also remember in the first year, one of the people that I was talking to in this process in that first year needed an ALS response. And I have not forgotten the comment that came in and said, I'm so grateful to the town for doing this because we didn't know it was coming, but we needed this response and it was there. So quite aside from the financial side of this, just the capability of a fast response is a key. I do care about the financial side, but not more than that. So that's, I think that's great. I have one question only because I picked up vibes that if we accept the Safer Grant, there are implications or ramifications for the town. And I read through your stuff. I did highlight a bunch of the boilerplate things, and I have questions about, has anybody besides me read what these were? And are we actually squared away with like things like, do we have a policy for best practices for collection and use of personally identifiable information? That's just,
Well, we don't hand out personal information to anybody. We have HIPAA laws that are in place for all the medical information. I don't share any of the personal information of the firefighters.
so my only point, and some of these are miscellaneous. There was one on Energy Policy and Conservation Act.
Right.
It's all the boilerplate, I know.
is.
It's just that when we sign something, we say, yep, we've got all this. They're standard, I understand that. So I'm saying, well, I would hope at some point in the last 10 years, we actually confirmed that when we signed to say we're going to have these, we really do. There were a few that jumped out at me. I'll pass them on to you.
There's
with
one
my
big
comments.
one that's on there. It's a civil rights requirement.
Yeah.
So I'm required to go onto the civil rights website and then enter in a whole bunch of information. And they want to have the town's civil right policy. They want to know how many people have filed complaints on rights violations. So this is a whole brand new section that I've never had to take care of before. So what it's going to do, it's going to require the board to actually come up with a civil rights policy. And I'm going to be working with Christine on that and the town's attorney, labor
Yeah,
attorney.
we met with Jamie Kenny on Friday to discuss some of those and what the implications would be.
My whole point was, there's this big long list. My first inclination was just to flip it. And I said, wait a minute, let's slow down and make sure, as long as I know somebody in the town is doing that we're staying straight. If we sign and say we're doing it, then I'm saying we have to do it. They're paying us $1 million to go through this list and make sure it's okay. I'm good with that. So
Yeah, that information was on the AFG grants that I received. It was on the regional AFG grant that I received. So I've been dealing with AFG grants and safer grants for 15 years now.
So then the only other issue I have, and it's not one that's this gives us the ability to hire people for 3 years. In principle, if we decide to hire someone to do this job that we think is worth spending federal money on, I would prefer to be confident that in 3 years' time, we would not be saying, oh, no more federal money. I guess we don't want to spend money on this. So I just float this as a thing on my mind. It's not a do or die question right now, but I will be interested at some point as we go through this process to hear that assuming this all works well and we're happy we did it and the things we think will happen, that we also be thinking about what would it take for the town to pick up this responsibility to keep this capability. Now, if we decide for 3 years we really don't like it, that's different. But I wouldn't want us in 4 years or 3 years' time to say, oh, we're going to stop it. And the only reason we're stopping it isn't because people we hired aren't doing a good job, isn't because the service isn't valuable to the town, but we just don't want to cough up the money that the federal government, we should have some idea of, this may be something you should track, is that
Oh, I
as
would.
this
I
goes
track
through.
everything.
I know. I'm giving you future questions here, but what I'm saying is at some point, 3 years out, there's a business discussion to be had about, does it make sense for the town to pick this up on its own dime? That argument should take into account the incremental revenues, so that when we're asking that question, we're seeing the true incremental cost, net cost to the town of it, as we consider the value of actually being able to provide a service. All things being equal, I would prefer not to set it up where we have somebody we hire for 3 years and then say, sorry, the federal government's not giving us money anymore, so we'll see you later, if they're doing a good job at least. So that's just me looking down the road saying, I hope that we avoid that trajectory is all.
That's all?
So, yeah, so it sounds like the question, if you want more questions, but
So let me, I do want to, and then I will have Steve come up, because I look at this as, it's a win because it gives you a 3-year window. And you and I have talked a lot about just if we could have that fourth paramedic on, it really can change the dynamics. And kind of what you're saying, but I'll go on the other end that says, we have a 3-year window for you to then come back to us and say, you know what, this fell right into what I was expecting. Or maybe halfway through, we approach you and say, is this going down the path you thought? Is it solving some of the problems that you were facing far beyond what you expected? So it sets us up at the end of year 3. Certainly don't want to have to let somebody go. But I'm curious, are there towns that have received the SAFER over the last year, well, say 5-10 years, at the end of the 3 years that they actually have let some of their,
Fall River.
okay.
Yeah.
And was it purely financial or, okay.
Yeah. Yeah, I don't know how many firefighters they got. It's happened quite a bit, and there have been towns that turned down SAFER grants too. I specifically know Chief Lance Benjamino in Middleborough. He got the grant for 16 firefighters because he was trying to take over the ambulance service because they were covering 72 square miles with one station. It was kind of a crazy dynamic down there, and they turned the grant down. And the kind of the unofficial rule is that if you turn the grant down, you should not be even considering applying for quite a few years because you'll be considered a bad risk because they're not going to, give you a grant and then say, have that happen again.
Sure. Okay.
But there are, it's kind of crazy. There are people who have kept them, and it's been all over the place. It seems like the bigger cities are the ones that they receive the grant and then they just can't sustain it. It seemed to be a lot of fire departments that don't offer EMS too. It's like a regular fire department trying to get their minimum staffings up. Because NFPA 1710 also has requirements for a number of firefighters on fireground scenes. And those numbers and the response criteria are based on distances traveled. So a lot of fire departments will say, okay, one station's covering so many square miles and it takes 4 minutes to get there. There were areas in Sandwich when I was there that we had 12-minute response times. And that kicked off the whole multiple station opening up the stations that were closed. And we went down that road.
Okay.
But here being centrally located, for the most part, we can get to any point in town with 6 to 4 minutes on a good day. Obviously, weather dependent, it gets a little worse. But
Well, I look at it too is we've got this 3-year window. When would you officially kick in the first hire?
well, as I'm pretty close to being ready to go.
Okay.
We had a firefighter paramedic leave a couple months ago. He went to the town of Franklin. So when I went for his replacement, I interviewed a whole bunch of extra people, building a list. Because at that time, we had gotten notified that the grant actually called me and asked me some questions. And usually when that happens, it's a precursor to getting an award. But they say, hey, we just want to ask you a couple of questions. You weren't really clear on this. You're in the final stages of review. And then they say, hey, I have to read you the disclaimer just because I'm talking to you right now. Doesn't mean you're going to get a grant. And then at the end of the conversation, it's like, hey, you'll hear from us soon. Bye. So I have known this was coming for probably 8 weeks before it actually arrived. And it's been a long 8 weeks.
So the way I look at the 3-year window
in the bottom half, not necessarily at the bottom half.
No, not at the
But
very
I would
bottom.
think we would be targeting wanting to be in the sweet spot in the middle or slightly above the middle. So you said, well, if you want me to, I'll look at it. I'm thinking we want you to.
Okay. What happens is a Comstar ambulance billing company, they send me this every year. So they'll say, hey, Medfield compared to all of our other agencies, you are here, and do you want to increase? It's kind of tough, with ambulance billing. I think the last time I was looking at it, it was right in the middle of COVID, and everybody was getting hit. So I wasn't about to bring that into to have you guys make that decision because I didn't think it was fair to the public.
Yeah. I just didn't want to let that detail slip.
So I know I see a couple of members of the warrant committee. Steve, if you want to bring forth any information that you think is important to share, I'm more than welcome to grab the mic.
It's on. Yeah, they can only hear you at home.
Well, congratulations getting the grant. The chief's been working on this for a long time. We did talk about this at our meeting last week as a committee. And we had questions really, around the revenue that was going to, be generated. Some of these got answered tonight. But we really didn't take a perspective on the safety aspect of this, the need from a safety perspective for these additional hires. We really just focused on the financial. And one of the big things that you should understand, I'm sure you do, making a decision like this, it's going to be a difficult one, is that in 2029, the financial projections that the town finance puts together, it shows deficits all the way out to 2029. But 2029, it's a $2.4 million deficit. And so what would happen in 2029 is this $400,000 for the four people would come onto the operating budget, turning it into a $2.9 million deficit. And so unless two things happen, we get an override passed at town meeting, or to be blunt, but those are the choices. In the meantime, the grant will take care of the financial need. Although I did learn tonight there's there's $50,000 of extra cost each year that we'll need to budget for. We should be able to, I think, manage that, I would think. But the other idea that came up, which I thought was a good idea, we didn't really explore it too much. Ed Vazella had this idea, was to, during this 3-year period, take any revenue that's generated from the 4 additional hires and leave it in the revolving fund. Don't use it. Right now, we use that revenue to offset the budget or capital items. Leave it in there so that when we do get to 2029 and there's a big hit to the operating budget, we can, hopefully smooth out that hit. So those are the only things I have to add. I really have no idea on the safety aspect of this, but that's important consideration. So,
Okay,
all right.
thank you. Anyone else have any questions, comments? Go up there, if you wouldn't mind.
I guess just a quick comment. 3 years is a long time. It's a long time horizon. So based upon what's transpiring over the course of that 3 years, you can make adjustments. You just said you had a firefighter leave going to Franklin. So if things are going south, you can easily, through attrition, maybe not hire an additional person to offset the additional revenue, the additional expense. So
Part of the grant, we are required to keep a staffing level of 17 for the entire 36 months.
does that 17 include the additional 4?
That is including the additional 4 and myself. So what happens is people can leave, but you have to replace them. That happened in Sandwich when I was there, because we had a lot of people retire out. So what happens is basically they just move up the list,
Right.
and then you have to backfill the people. But I'm required to keep a number of 17.
There goes that comment.
There's some other things you can do. I can do that I'm going to talk to Christine about. She knows that at the end of the fiscal year, I am horrified if I have to come in and ask for money, and she actually enjoys it, watching me squirm and saying, because I hate asking for money to get through the fiscal year. For the most part, I take a lot of pride in doing the budget and trying to get it on target and trying to give you guys real numbers. So if it were to be accepted, obviously there's a lot of work for myself. There'll be a lot of tracking. The quarterly updates would include the status of SAFER, the revenue generated by those individuals. So a lot of that stuff, I'd be able to provide you. And the thing is once you're a year out to the end of the grant, obviously that's when you have to start making your projections and your determinations on where you're going to go. There's a couple of different options. At the end of the 36 months, you can do through attrition, just start letting people go through attrition. So there's a whole bunch of different opportunities and different things that you could do.
Thank you.
So are we prepared to vote on this tonight?
Yeah, just to make sure, given the concerns or the issues that Steve raised, you need us to vote to accept it or not accept it.
I need an
really
accept or not
tonight,
accept.
because we're not going to meet before the 23rd.
Correct.
Yeah, so we are voting on it tonight.
Okay.
Yeah.
Any more questions, comments, Pete, before we go to motion?
I'll just say that, I think that it makes sense to approve it. The financial concerns are huge, unfortunately. One of the things that back around 1980, I remember reading in the Wall Street Journal that General Motors didn't regard hiring a new employee as a $60,000 a year event, because it was that long ago that I read that. It was like $1 million event for them, because they were looking at the person's pay over their lifetime. And so this is one of the things that we haven't factored into this is the OPEB for the retirees, because we found that, we have like a $30 million nut that we're trying to pay back on that, because we never funded it in the past. We're trying to keep up on that now, but that's not actually factored into these numbers either. So,
The grant covers those.
Grant covers OPEB.
well, it covers OPEB for the
4
years,
firefighters.
but we're going to have these people on pensions
Yep.
and health care after they retire. Hopefully, they're going to spend their career in Medfield, and they'll be lifetime employees with us. And then we have I don't know what that number is, but
So at the end of the 3 years, is it your determination or our determination to keep the,
Well, at the end of the 36 months, obviously I would come to you and say, okay, we are
Yeah.
at our time. What say you?
Okay.
Obviously, I would be having these discussions ahead of time
sure,
with Christine, because obviously when I do my budget presentations, I'm going to be including the 4 bodies in that next budget cycle.
okay. But I think that's when, to me, it's no secret, I support this, right? Because it's 3 years out. And in that going to that 3rd year, that's when we can really look at the hard numbers and say, are we ready to take this on as a town? Or like Fall River, we hit a brick wall and we have to do what we have to do. But I think right now, I've heard so much from you over the last year, is what SAFER could do, that I feel like we have nothing but to gain for the next 3 years. So if we're ready to go to a vote?
Yes.
Motion? Oh, sure. Do you mind coming over the microphone? Only because people at home who are watching this and they're recording, we want to make sure we can hear.
Should identify.
And yeah, and if you don't mind identifying yourself.
Chad Boylan, 27 Wichita.
Okay, thank you.
I just want to say, you can build the biggest, nicest fire station. Sorry, I hate public speaking. I don't want to be
No, no,
here.
no, no, no.
You can build the biggest, nicest fire station like the one you have on the street. It will be a crappy fire department without these guys back here.
Totally agree.
These are the ones who make it.
Yep.
Now, you did a lot of talk about budgets. You did very little talk about the safety of the people. I'm a firefighter in a city close by. These guys do with 2 or 3 people on a medical call. I do with 7 or 8. And as an officer, these guys are amazing what they do. So sorry, I'm in a bad mood. I'm a little frustrated because I was on the ALS committee. It took us about a year to finally get to ALS. When we brought it to town meeting, it was overwhelming. They wanted it. We got 13 call members. They are the most dedicated, probably people in the town. Nobody else would get up at 4 a.m. in February. It is -5 day, and then working 9 to 5. I don't know what the population of town is, 13,000 roughly. So you got 13 people out of 13,000. It's not there. The call people aren't. It's a different town than 20 years ago.
Absolutely.
This is the way we're going. We need to progress. I mean, that's
Okay.
sorry.
Thank you.
So, thank you.
Thank you so much. I would just make 3 points from what you said. You're a great public speaker, so thank you. And the people that he was pointing to or talking about was the Medfield firefighters who were all standing at the back of the room. There are probably a dozen of them here to hear what happens on this. So I just wanted the people at home to know that.
I told them to stay home.
Yeah, because the camera can't go to the back, so.
And I think I heard that 3 of our firefighters do what 7 of his in his town do. So that's pretty
We're
impressive.
way more efficient than cities.
Go on.
Chad, are you a paramedic by any chance?
So motion?
I move that we accept the safer grant.
Second.
All those in favor?
Aye.
Aye. All right, all
On
those
behalf
against?
of the fire department, I thank you.
All right, no, thank you. Thank you, guys.
Need to be authorized to sign anything?
No, the chief has authorization.
All right. All right, next up, I see Kathy back there.
Frank has the slides, yeah.
All right, so next up, Kathy McDonald, Director of Outreach, to provide a semi-annual update to the Select Board and request the signing of the contract for the Safe Coalition for the development of a potential spending plan for the town's opioid settlement funds. Settlement
That's
funds.
okay. Frank has slides for me, so that's why it's not a dramatic pause or anything, so, yeah. Good evening, and so this was an update from Medfield Outreach, but I've chosen to use my focus this evening on one of the things we're overseeing, which is the opioid abatement funding. I feel we're overdue for an update, and so I'm eager to bring it to you this evening. And on the heels of that, I'm respectfully requesting that you consider a contract that will get us moving on starting to do some of this work, which I'll explain during the presentation. So, thank you. So just to sort of frame what are the abatement funds, in July of 2021, Attorney General Maura Healey, now our governor, announced a $26 billion resolution with opioid distributors, which will provide more than $500 million to the Commonwealth and its cities and towns for prevention, harm reduction, treatment, and recovery across Massachusetts. Funds from these settlements began flowing into Massachusetts in June of 2022. So some of those settlements have been finalized and some are ongoing. But nearly all the towns and cities in Massachusetts are currently receiving funds under these settlements. And as of February of 2023, about $42 million had been received by Massachusetts cities and towns. Next slide. I think it bears noting that there are ongoing settlements currently. There are too many to list, so I created a link there, and I'm sure this will go out in your minutes and such that you could click the link if you are curious about what litigation is currently underway and what settlements may or may not come our way in the future. Next slide. Under our current state subdivision agreement, municipalities receive 40% of those funds, and the state, the Opioid Recovery and Remediation Fund, known as ORF, receives 60%. So there are requirements under this abatement agreement and the state subdivision agreement. So most all of this presentation tonight really comes directly from that settlement from Governor Healey. And these funds are required to use to supplement and strengthen resources for prevention, harm reduction, treatment, and recovery. We are required by the Executive Office of Health and Human Services to do reporting every year, and that reporting goes up to a web-based platform called the dashboard. Next slide. The commitment to abatement. So this is, I just took snapshots out of the legal sort of agreement because it's pretty dense, and I didn't think you all really wanted to read the complete agreement this evening. But our commitment to abatement is to be reflective of our community's needs. And that means by listening to stakeholders, by listening to people who have been touched with personal experience with the opioid crisis, by listening to experts in treatment and prevention, and by recognizing the staff and organizations that are currently doing abatement work, like recovery centers, peer recovery centers, et cetera. In addition to that, this money is meant to leverage programs and services already reimbursed by the state, to encourage innovation and fill gaps in treatments or shortcomings of existing approaches. And very important, again, to supplement, not supplant. So you can't take this money, reduce funding from somewhere else, and use that money to replace. You have to supplement or create new programs. And we have to consider evidence-based and evidence-informed treatment. So this isn't just willy-nilly, it's very science-based. However, we're allowed to take advantage of the flexibility to be responsive to our specific and unique community's needs. Next slide. So in the abatement fund sub-agreement, there's lots of words in these legalese things, state sub-agreement, there are 7 different strategies that have been approved. And these 7 are the following: treatment, support, harm reduction, connection to care, meeting the needs of justice-involved individuals, support for pregnant and parenting individuals and their children, prevention, and prevention education. So certain communities and cities are going to have different needs than others that might be more, heavily weighted in maybe 7 for us, right? Maybe 1, 2, 3, 4, and 7, maybe in this community. Might be very different somewhere else. But we need to take that data from, next slide, I'll show you. Oh, in the bottom, let me just bring your attention, that little bottom link there is a link directly to the state subdivision agreement. So if you want to read it in its entirety, it is there for you. It's also right here in my file, but what have I been doing to this point? I've been getting informed and educated about all the requirements that come along with handling these funds. Doing that through technical assistance with CARE Massachusetts. So what is CARE Massachusetts? JSI, which is the John Snow Institute, was contracted by the Massachusetts Department of Public Health and BSAS, which is the Bureau of Substance Use Disorders or Substance Use Disorder Treatment, BSAS, to provide technical assistance to communities in Massachusetts regarding this agreement. And they've been offering webinars and conferences and office hours and lunch and learns, of which I've taken advantage of many, many times. I went to a 2-day conference. Frank and I have been on calls together. Probably a dozen different training opportunities I've been in over the past year. In addition to that, I've had one-to-one technical assistance. We have someone that's assigned to our catchment area. Her name is Kate Lena. She works for JSI. And I brought her up to speed with what we've done so far and where we are in my proposal to you this evening. And we are within the scope and within the framework of what the state wants from us. Next slide. This is just a little snapshot. This is the dashboard. Anyone, and there's a link here on the dashboard for the dashboard too. Anyone can click the link and you can just hover over your community and it will tell you how many funds have been received, like in dollar amount to your community. And under that amount, it will tell you how your community has used the funds thus far. What of the 7 strategies have been utilized? What barriers are there? What successes have you achieved? So you could do that to any one of those communities. What I will tell you, it's a little bit laggy, meaning that it's only updated as of 2023 was the last reporting cycle. So our funds received to date are reflective of 2023 and not for 2024. If you hover on Medfield, you will see that there has been no funds spent. That's true-ish. We have spent about $100, and I'll show you on a future slide on what. But there's also a reason that we haven't spent a lot of money, and it's because we haven't done the preliminary work of hearing from our stakeholders and our community members about exactly in what ways are specific to this community and how we should use them. By that, I mean, we shouldn't suppose we understand the way to spend the money when this is supposed to be remediation for people who have been touched by the opioid epidemic. We need to take steps to have opportunities to hear from our community members. But I encourage you to check out the dashboard. Next slide.
Keep me on my toes.
Yeah. So what are our next steps in Medfield? So let me just start by saying the reason we've had a little bit of lag here, and the reason why I'm asking you to consider the contract that I'll speak about next, is that we've had an open job rec to increase capacity for someone to do this work in Medfield. That is still posted on the website. We've relisted it out to LinkedIn. We're looking for someone who can do this work. It's hard to find people right now. It's really tough to fill positions. We haven't been able to find a qualified candidate. So we've sort of been waiting. And I'm getting as eager, as I'm sure other community members are getting eager, to just start this work. And so a lot of other communities have contracted out the initial phase of the work so that we can get that information, gather the data, and get moving on using these funds in the way that is most appropriate for our community. What does that look like? Well, that would look like meeting with stakeholders. That might include fire, police, board of health, prevention staff, school administrators, select board members, individuals with lived experience. Any community member that wants to be involved in this is considered a stakeholder, quite frankly. To offer 3 community listening sessions. Those are just opportunities for people with lived experience to come and speak to someone. I think it's particularly attractive to have a coalition that does that day in and day out. And I'm using the word coalition, but the SAFE Coalition is a nonprofit, so it's not really a community-based coalition. It is a business. It's a nonprofit. Because of the stigma and shame attached to substance use and substance use disorders, I think it really behooves us to have people who are sensitive and understand how to ask the questions, understand how to do that work and do it day in and day out, and have dedicated their business to doing that. And that's the SAFE Coalition, which I'll talk about momentarily. We would need to gather and analyze current data. What are our critical incidents? What are our response rates? Whatever overdoses or suspected overdoses look like, as well as gather new data in the forms of a survey. So in the abatement agreement, they talk about, there's a sample survey that other communities have used. I have a link in a future slide of what that looks like. And it collects basic data, and then we can add or customize those questions. And like I said, have a link if you want to see what that looks like. Then we would synthesize the data that we gather from that survey. I wouldn't, this is safe if you're also inclined. We would have a report, and then we would decide collectively, based on the data from our community, what do we want to do with these funds going forward? Mm-hmm. What makes the most sense? Next slide. SAFE. Why SAFE? SAFE is in Franklin, Massachusetts. It's a nonprofit organization that helps to educate and support those impacted by the substance use disorders and mental health concerns. They work in over, 36 communities. We already have a working relationship with SAFE. SAFE, it works very closely with the DA's office. As do we, with a lot of the work that we do through our prevention arm. They're dedicated and committed to recovery work. They helped us do, actually, Frank, if you go to the next slide. Well, actually, never mind, pause. They've helped us do our naloxone, the sandboxes that we have, the 10 sandboxes, which is the nalox box that has the double doses of Narcan and the safety equipment. We got 10 of those through the DA's office in partnership with the SAFE Coalition. And we have, I believe, 10 of those in various municipal offices here. In addition to that, there was Narcan training that was put on by SAFE Coalition, both for town employees and community members. And everyone who attended that got 2 doses of Narcan to take on that person to have. So we have an ongoing relationship already. The SAFE Coalition founder works for the DA's office also and heads up all the monthly prevention conferences that we go to. So we have a very good working relationship with the folks that do this work. The community needs assessment, that's just the other name for the survey. Why is it important? For all the reasons that you would expect, to raise awareness about these funds, to gather essential information about the community, the impacts on our community and our community's needs, to help identify any service gaps or desires for new services, barriers to care, and to inform us about the strategies that we're going to use in our community. So, next slide. Oh, on the bottom of that, I did link Foxborough's survey if you wanted to see what Foxborough did. And the reason I'm picking Foxborough is they were used as a model town by CARE Massachusetts when we were in one of our trainings. They kept referring to them, so I linked that. And this is our action thus far. What have we done so far? So the sandboxes, nalox training, we replaced the naloxone in all the police medical bags here in Medfield. And you see those little blue pouches? That's your $100 that we spent. The police department thought it would be very helpful if the naloxone, which comes in 2 separate boxes, and those boxes wear down and then they kind of float around in the backpack, if they could be contained with gloves somewhere quickly, that if they're responding to an emergency, they can reach right in and pull out exactly what they need in a moment's notice. I thought that was an incredibly reasonable request, and it was $100. So, so now our police department has nalox cases and brand new naloxone. So that's all the money we've spent, and until we do these next steps. Yeah. Next slide. If anyone is interested in this work or being involved in this work, reach out. Happy to have you. And I would ask that you consider, I know it's next on the agenda, which is considering that we allow the SAFE Coalition to help us get these preliminary steps done. But I'll pause and see if you have questions about this part first.
Thank you very much, Kathy.
You're
I
welcome.
always appreciate the information you bring us. Do you have, I know that the settlements are ongoing, but do you have any idea of the magnitude of the amounts that you're going to get?
Well, we do. We know the settlement, the one that's been settled, is a 15-year settlement. And Christine, correct me if I'm wrong, but the amounts paid out tend to taper off over time, over the 15 years. So it starts out at one rate and then it goes down. I think if you look on the dashboard, currently it'll tell you that we've received about $93,000 to date. However, that does not include 2024, which don't quote me specifically, but I believe was around 100,000. And I know I just told you it tapers down and that 100,000 is more than 93. I'm very well aware of that. But and we've spent $100. So I think we have a responsibility to get this going. We're holding these funds and to serve our community in the ways that make sense. So 15 years is what we know. Pete, we don't know the outcomes of those pending litigations, but you are an attorney, and I did put a little link there. So if you want to read those and tell us where they're at, that would be
Okay.
fabulous.
In my free time, thank you. That's all I had. Thank you so much.
Of course. Thank you.
So just a reaction, Kathy, on
Sure.
in trying to visualize what we're doing and how we're doing it. One of the early slides you had talked about the fact that we're trying to use evidence-based and evidence-informed information, which makes eminent good sense to me. What I'm trying to visualize is one piece of, let me back up. This first phase sounds like what it really is trying to get a handle on what is really needed in the community that would be most effective in order to be informed maybe about which of those 7 strategies would be the most logical strategies or most effective strategies for the town to pursue.
Correct.
If you've got 93,000 in the first year, 100,000, and that's only one of several settlements, at some point there's going to be some funds that are going to be capable of doing some pretty significant things if we think we have pretty significant things that we need to do. In trying to figure out what the answer to that question, it makes eminent good sense. I can see the objective information that we can get from the public safety departments and other places, like maybe public records, I don't even know, but there's some real objective hard data that's available. And then I don't object to the public sessions where people just come in, but as I visualize those kinds of public sessions, I'm saying it might get you anecdotal data. It's not actually really data that will be quantifiable in a way that would enable you to say, we're going to go in this direction rather than that direction, because it's sort of just a random collection of inputs from people who are motivated to participate in those sessions. Is that
Perhaps, however, it could be telling in barriers to treatment, barriers to care. So, for example, if you search recovery centers, you might see that there's a whole bunch in Western Mass, and there's a shortage in the right, like in our sort of catchment area. We might notice that there's very few treatment options for youth. that our understanding of what are addictive substances and what aren't is evolving all the time. So as we start to hear these anecdotal stories, it informs us on a low number level, but on a subjective level. And from that, we can share. So we also participate in some cluster, the BSAS mass call that I just talked to you guys about a couple weeks ago. We share data, about that too, and we can start to look for trends. This also pairs beautifully with our prevention work, which we have a lot of data about. So I would say, well, I hear what you're saying. Sometimes those small N testimonials yield investigative questions that then we can go after and get that harder data that you're looking
Okay,
at.
yeah, so but that was, and again, I didn't have a position, I was just trying to picture, I could picture one piece of this that was objective and sounded to me like it could potentially give you a good, complete picture in order to, where I'm coming from is, I'm assuming there's prioritization decisions that will get made at some point. We'll figure out what's important and what's not important, and I'm just trying to visualize the process that gets you to those kinds of answers. And some of the stuff that's subjective is like, well, if one person comes in and says, like, I don't know where to get treatment, I don't think that leads you to a conclusion that we have a problem with treatment. It just means somebody came in and didn't know how to get it.
Correct, but if we had someone that said, my child was ready for detox, but there was no bed available, right? So there's 3 different times that my child is right at the right place, that they're ready, and there's no bed available. Well, that's something we're going to want to look into, right? Regionally, not
Right, so
we're
you-
not going to be able
yeah,
to build a
yeah.
treatment center in Medfield with that, or my child was ready, but we have no vehicle and we couldn't get my child to the treatment center. Okay, well, do we start looking into some way to access or leverage transportation services, either from a detox facility or through a contract? Do we leverage opioid funds that way? Is this something that's true for other people in Metro West or in Medfield?
Yeah, I think,
Things like
so I think the key, I understand how you use subjective stuff to spot trends.
Yeah.
If there's one data point in Medfield that says this, it only becomes important information when, well, gee, there's that same data point showed up and it starts to look, I get that, okay. And I was just trying to figure out how this process unfolded, and that was because I was trying to visualize, you already know my reactions to the draft, so that's not on the table, but it's a $3,200 contract. I don't think it's going to take, it's
Right.
not going to be hard for us to decide to do it. My bigger issue is really for the kind of issues that you're talking about, trying to say, so what is it these guys are going to be so good at for $3,200 in, three public, it's like I didn't really know what they were producing.
Yeah. Well, the template's already there, so it's sort of having someone that's familiar with the work, who's done it in other communities, to come in and do it with ours, because they're not reinventing the wheel. They're taking this framework and they're doing it until we hire that person. That this will become their full-time job. That it's connections to care, that it's following up, that it's wraparound services, that it's a call the next day after fire department responds, or whatever that data shows us that we're lacking or having gaps in our services here. Probably a lot of it might be prevention in Medfield. We don't have many incarcerated, there's certain demographics here, they're going to say out of those 7 strategies, those are less likely here in Medfield than some of the other 7 strategies. And within every of those strategies, probably 15 points within each of those 7 strategies.
Then my next question is, so this is one little 90-day contract for $3,200, as we've seen the draft. You're looking to hire an abatement person, so there's a job, which is all this coordination. This little thing isn't filling that job.
No.
Is the
That
thought that they
job-
might continue on? Are they Mo, like this? Are they the water treatment plant operator that we can't hire? That's basically, will they become a sustaining resource?
Yes. Because well, I can't presuppose exactly what of those 7 strategies they will be doing. They will be doing, in whatever hierarchical way that data comes in, that work, or
Okay, so there is a-
finding connections to connect people to that work. And if there ever was a shortage of work to be done, which I highly doubt, then we're going to pivot to prevention.
Yeah.
Because there's always prevention work to be done. And right now our prevention arm really is, through our federal funding, is only 0 to 18-year-olds. So this opens up the 18 plus to try to keep wellness in our community. And prevention and wellness can look a whole bunch of different ways. And that's under the 7 strategies. So there will never be a shortage of work.
Okay, so That helps. So this little thing we're talking about is the start, but actually the real plan would be to be able to supplement the staff.
Correct.
I got it. Okay.
Correct.
And that all gets paid out of the opioid
Yep.
settlement fund. Got it. Okay.
So because I'm familiar with Medfield Cares About Prevention, you know, some of the internship programs that we saw the young kids present about a month or so ago?
Yes.
Would some of this money, so this SAFE comes in and they see some things, would some of this money allow the interns to pass some of their ideas along to have their projects implemented? Like I saw the one with the posters and some handouts, and that costs money. Is that all of what some of this opioid settlement would help fund?
So yes, maybe.
Okay.
And DCF funds for our prevention arm. We have a budget and a budget narrative and a performance narrative that speaks to a lot of the work that the youth are doing.
Okay.
But do I see that synergistically working together, and could those things be combined? Yes.
Okay. Okay.
Yes,
Great.
for sure.
Okay. Yeah, I think it's $3,200 to help you make sure that we are getting ready to implement this the right way, because a silly question, but the 93,000 we have, could we ever lose that because we're not actually using it and implementing it the way the,
No, that went
Okay.
into a stabilization fund. if I'm
Okay.
not mistaken. Yeah, that's earmarked.
okay. All right. Any questions from anybody? We're good?
Who wants to help me?
All right, Mark?
I just want to point out that my recommendation was to use the town's contract with theirs attached.
We will, yeah.
For a description and a scope of work and pricing only, because that's really the way it ought to be done.
Okay, so we won't sign this contract. We'll,
You're gonna authorize me to sign the contract, and Kathy and I will put it in the town's contract format.
okay, yeah. Yeah, I found it interesting that they defined organization and then they never use it throughout the entire contract. They then refer to themselves as a consultant. I'm like, then why do they define organization? It was just, yeah, it was an interesting contract.
Okay, now I have questions, because you've gotten my feedback on the draft contract, which I thought had serious flaws, both qualitative and actually legal.
Yep.
Mark, you're saying you're just gonna fold that into the town contract?
Only as we typically do for description of the scope of services being provided and the pricing. All the rest of it will be disregarded.
We're not
Terms and
taking any,
termination
yeah,
and all that gone.
we're not taking any of their language.
Okay, good.
They
just
were
their
trying to
scope
do
of
me a
work.
favor. I said, can you get me something quickly?
Sure.
Yeah.
That's where that came from.
Yeah.
All right, motion.
I move that we approve, or we authorize the town administrator to sign the town contract with
Yes.
SAFE, incorporating the scope and pricing from SAFE's draft contract.
For the 3,200.
Second over there?
Second.
Okay, all those in favor?
Aye.
Aye, aye. All right, excellent.
Thank you very much.
Thank you, Kathy.
Thanks, Kathy.
All right, Maurice Goulet, DPW Director, and Ken Ho of Beta Engineering to provide an update on the MassDOT Route 27 West Street intersection review process. Good evening, Mo.
Good evening. How are you? As you know, we got Ken Ho. You're going to get to know him more and more every time he comes. As you know, Ken and Jacqueline Centracchio are our consultants from Beta that are working hard to move this project forward. Ken's going to give a kind of a discussion on maybe the transition from Mass DOT Stage 1 into Stage 2, give you an understanding of the process, get to know a little bit more information. He's got some different information to let everybody know about, and what the next steps are, to give a good understanding of what the next steps are as we try to get this project moving along further. Okay?
Great,
So
thank
I'm
you.
going to give it to Ken, and if any questions, we can.
All right, welcome, Ken.
Thank you, Mo. Thank you, Madam Chair. Just for the record, my name is Ken Ho with Beta Group. We are the design consultant for the town of Medfield for the intersection of 27 and West Street. There are a few things that happened. Since our last meeting, we submitted the ICE 1 process. We have to resubmit it because when we submitted back in 2021, it was really outdated. DOT had constantly updated their process. And as a matter of fact, we went to one of their class where they offer to consultants last week, and we have attended that class. This is specifically geared towards the ICE process submittal. So the good news is that they approved ICE 1. And if you recall, ICE 1 basically identify what are the design alternative for the intersection. So as part of ICE 1, we identified two concepts, the signalized intersection and the roundabout. So they agree that, oh, yep, you have two viable options. So they approved ICE 1. So now we're getting ready to submit ICE 2 process. And I have copies of the ICE 2 if you want for reference. So as part of the ICE 2 process, basically right at the very top, well, almost at the very top, right before the project information, it asks to identify the intersection control strategy or concept that was identified in stage 1. So we would highlight the signalized option and the roundabout option. And right next to it, it asks, was a fatal flaw, identified after stage 1 for any of the two viable options. So this is where, you identify if there are any concern with any of the two options. And if you recall, I believe there was some concern with right-of-way impact. So this is where you would identify the right-of-way impact associated with the roundabout concept. And let me just explain, at the class, per se, last week, when my folks attended, the fatal flaw were being asked, can you define what's fatal flaw? If we were to check fatal flaw. And the response that we got was, more recently, there were two communities where they check off the box, fatal flaw, and you have to explain, the reasons, why do you check off fatal flaw? And we were told that in this case, it's likely that DOT will grant a waiver to bypass the option that the town has some concern with, and to go with the option where there aren't any concern. So that's the definition of fatal flaw.
Okay.
So I think, and the rest, it's pretty straightforward. And so I just wanted to update the town as we move to the next step. If that's the approach that we wanted to complete the form before we submit.
So I have some questions, but I'll go to Pete and Gus if you have any questions before I ask.
Ken, first of all, thank you for helping me since you were last here. Both you and your colleague were very generous in terms of emailing me back when I had questions and emailed, so I appreciate that. I'm not quite sure that I understand where we are, so that at this point we're moving into the ICE 2?
Yes.
And what was that about fatal flaws that we're gonna?
So let me just.
So you have material that you were gonna offer us,
approach,
but I'd love to see it.
So here's a copy of the ICE 2 form that we will complete
Great, thank you.
and submit.
Thank you so much.
Yeah. So at the very top, it's just basic project information. And right below that, there's a big box. It says, list all the intersection control strategy, which basically are the viable options. And then right next to that, it's identified as, was a fatal flaw identified after stage 1 for the two viable option, that were identified as part of stage 1.
So are we gonna tell MassDOT that there is a fatal flaw?
That's
That's the question.
that's
The
the
question.
question that I'm asking. Yes.
So right of way, would that be considered a fatal flaw? If you did not have the land to take, or that was something that would significantly slow down the project, is that considered a fatal flaw?
Well, it actually, it's mentioned. If you read, there's a box there right next to it. I know there's fine print. It talks about typical fatal flaws identified after completing the ice stage 1. And it goes on to list, it could, whether are there Article 97 involved, which is historical matters, and or municipal opposition to improvements located within municipal right-of-way layouts. So that's referring to the right-of-way.
Ken, what's that Article 97 implications? It says right-of-way impacts with Article 97 implications. I don't know what Article
That's
97 is.
conservation land.
Yeah, conservation, yeah, right, thank you.
All right, so that wouldn't apply here, right?
No,
No, okay.
Yeah.
So then the only other municipal flaw, or the fatal flaw would be is if municipal opposition exists.
it says opposition to improvements located within municipal roadway layout. That's referring to right-of-way.
And or municipal opposition to improvements located within municipal roadway layout. So that's basically saying if we as a town object to it, then that could be a fatal flaw.
Correct.
Okay. So we as a town need to tell you whether we object to it, basically.
Yes.
Okay.
You good?
I'll just state that I don't object to the right-of-way issues. I don't see that as a fatal flaw. I mean, I think that when you look at the peanut that you had crafted as a possibility, I think that that's the one that has virtually no impact on 67 West Street, which was the only side of the four that had any impact at all. The other three just have open space, open land, so there's really no right-of-way issue on those three. And the way that the peanut roundabout was envisioned, it doesn't really have any effect on 67 West Street in terms of a taking, so.
Was the peanut a legitimate option? I know those,
That is one of the option, yes.
okay.
It's, yeah, I know we use the term peanut, the technical term is turbo.
That's why we say peanut.
Oh, sorry, okay.
So that's, I mean, I just, I want to see the process go forward as quickly as it can, and, but my position is I don't want to see the town forego the roundabout option at this point and list that as a fatal flaw.
So I actually agree with Pete's point. The thing I struggle with here is that the roundabout, the only issue was the right of way, and the only right of way issue was with the designs that actually cut into that right of way. So I'm trying to understand. I don't want to preclude the roundabout by any means, because I think you kind of changed for sure for me. The reason I don't is the comment you made about the possibility that the roundabout actually could facilitate traffic flow on North Meadows Road. And I'm anticipating development up at the state hospital. And I would like to see us manage the roads, North Meadow Road, in a way that incentivizes more people up at the hospital to want to use North Meadow Road to get down south than to decide to come down Hospital Road onto Harding Street, onto North Street. So that's the piece of this whole thing that I really am reluctant to preclude the roundabout just as a category. The thing I struggle with, though, is that, well, some of those roundabout designs do have right-of-way impact that I would say we don't want, which is the 67 North. Other ones don't, and so I don't think we'd want to preclude the possibility of having one of those that doesn't intrude, but we ought to understand that's the kind of a roundabout we want. So I can't tell whether, it sounds to me like we would say, no, there's not a fatal flaw, because there is a roundabout design that won't cause the problem with the right of way. There are other roundabout designs that would, but there's one, maybe there's more than one, depending on what you can do in terms of moving the entire roundabout. If, you know, if it was a way to force fit that you could avoid that. And I wouldn't want to rule that out categorically. So that sounds like if you don't want to rule it out categorically, but some of the variations would in fact be unacceptable right-of-way intrusions, you don't want to call the fundamental category of roundabout out as a fatally flawed category. Is that the right way to think about it?
Well, I wanted to be clear that, you know, I think when we dive into the design, especially the roundabout, because right now we have shown, you know, there are right-of-way impact, whether there were like, you know, 3 or 4 options that we have looked into. Some have a larger right-of-way impact. And certainly I think our goal is to try to minimize the right-of-way impact. But regardless of any option you pick, you know, there are right-of-way impact. But again, you know, we will try to minimize it. So are the right-of-way impact something that, again, I had mentioned that they are totally borne by the town, you know, the procuring, you know, the permanent easement and all that, working with the abutters. So that's totally on the town. And DOT will, you know, they do have a right-of-way department to help us manage it, but the heavy lifting is going to be done by the town to procure the right-of-way impact. So I just wanted to.
That's not the issue. The issue isn't the cost, the heavy lifting by the town to get the right of way. The issue is the impact on the one corner Pete mentioned that would have, at least in some of the designs, would have a significant impact on those businesses. And the concern that might be enough of an impact for us to lose what, you know, a couple of the few businesses we have in town that could potentially have a negative impact on that. So it's that corner. It's not, from my standpoint at least, it's not categorically, we don't want to have any right of way, you know, issues to deal with. I think the other ones, the corners, you know, it's right. Pete's right. They're inconsequential, I think. Maybe we probably have to have a public meeting or something to make sure that they feel that way, but.
Well, so here's something, I've gone by there a lot since this discussion got underway. And I've also looked at some other roundabouts around the state, and then I've looked at some crosswalk scenarios. So I want to throw something by you, Ken.
Yep.
So the intersection that we're talking about right now has 4 businesses, right, one on each corner.
Yep.
And then there's a 45-unit apartment complex. That exit is not that far from the intersection that we're talking about. It's okay that we take land from a business owner, right? That's what you're saying. Whether you passionately, but you're just saying we're going to take that land, which I am passionately against. I don't think we should be taking land when we don't have to. And you're also looking at entrances. Like I look at the company, and I mean, we'll call it because we know it's Paul McKechnie's. His entrance to his land, his lot is right near that intersection. If that is now pushed, and now we're going to put a roundabout that doesn't have to be there, we're now asking him, because he abuts conservation land on the backside, how does he get in and out of his lot, right? So you have a office building that has very little frontage that they use for parking and in and out right now. That we would have to take. You have a 45-unit apartment complex where there are people coming and going. There's a bus stop there, and there's no light now dictating. And I live at the corner of on Metacomet, one house in from South Street. And since this conversation, I've chuckled, and I should bring my camera on. I should turn my camera phone on when I go. People don't stop at the crosswalk, right? It's kind of funny. They start coming, they look at me, they go. And if somebody's far enough out and I start to move, then they finally slow down. And one guy the other night, because I didn't wave and say thank you, stopped, and there's 2 high school students that could attest to this, look back and he goes, "Hey lady, you didn't even say thank you. I didn't have to stop." I was like thinking, yeah, you did, sir. It's a crosswalk. So now we're going to put 4 crosswalks in a roundabout with no lights whatsoever. It's the common courtesy and the driver following the rules of a crosswalk. And that concerns me more when what we're talking about as a fatal flaw. If we put in a dedicated turn lane like we have at 27 and 109, where you can only take a left when there is a green light, there's no option like we have today, which has caused accidents where it's a green light and they're taking the left or they're going through, and whereas at least 27 and 109, there is you can't turn when it's red. You simply can't. Everyone going on the right-hand side of you can keep going because the light has now turned green for them to go. So I look at this intersection, and it does concern me that there are going to be 4 crosswalks on the edges of this roundabout. No lights dictating when kids can come or go, adults can come or go. We know downtown you have a white hand, that hand that goes white that says, okay, now you can cross. So I look at this and I think we don't have to take land. We could still have a very efficient, safe, and correct me if my next statement is completely off base, a lot faster. It would be a lot faster for the state to come in and improve that light significantly, that intersection significantly, versus if we go the route of a roundabout, it's going to be pushed out longer. That intersection is going to be at higher risk, and we're willingly doing that to explore something that we could do a lot faster. I'm just going to throw that out there, and I look for your comment.
Sure. I think when roundabout first came, around, this is, at least, 10, 15 years ago. Forget about Rotary. Rotary is a big, circle that you have seen. So these are roundabout. So I think one of the feature that a roundabout could provide that a traffic light cannot provide is traffic calming. So let me explain what that is. So at a roundabout is designed so that anyone approaching from any approach at any given time, they have to slow down and yield for cars entering. So in their design, which we call the deflection point, so a roundabout that's designed correctly, a car would traverse through the roundabout in 10 miles per hour. And if there's a car within the roundabout, they would have to stop, because they don't have the right of way. They have to yield. So at any given time, a roundabout will encourage people to slow down as they approach the intersection. You're talking about 10 miles per hour. Unlike a roundabout, a traffic lights, when someone sees the green, and especially if they sees the yellow, they could choose to slow down, but they could also choose to step on it. So there's that, no traffic calming effect, because basically you got the red light, you stop, you got the green light, and you go. So there's the chance of cars, speeding through a traffic light, even though if it's yellow. So there is that difference between a roundabout and a traffic light. So in terms of pedestrian safety, studies have, there were a lot of concerns with exactly what you said. There's no traffic light to stop, cars from going through an intersection. But in the case of a roundabout, because of the traffic calming effect, and because the way we will design the intersection, there are splitter island for each of the lane. So at any one time, you'll be only looking at one direction. When you're crossing and you come to a splitter island and you look the other direction, you don't have to look, because at any given times, cars are just coming into the intersection or leaving, and that's where you're crossing. So you're only looking at one direction, not having to worry about both directions. So between the traffic calming effect and the fact that, in general, the crosswalk, between Spitter Island are shorter than at an intersection, they're full, crosswalk. So you have to walk further. The longer the crosswalk, the more the pedestrians is exposed to vehicle hitting them. So in the case of a roundabout, you have shorter crosswalk, so your time within the roadway being exposed or being hit is less. And now you're looking at just one direction. In the case of a signalized intersection, when you're crossing, you could risk someone coming the other direction, passing through a yellow, or it could be someone the other direction. So you're exposed to two-way traffic. I hope that helps.
No, it definitely helps. And I look at that and I think we've got the crosswalks that are now going to be near entrances to buildings. So today, if you're leaving, Banfield Vet or you're leaving Aura, the nice thing is that the traffic light at least dictates there's going to be some stop in traffic, right? You're going to get a break in the action to go left or right. And if it's late at night and everyone's coming down West Street, like that is a very busy intersection because it's a cut through. Again, just throwing concerns out that now you've got people that are looking to exit, but there's nothing monitoring on a busy night. You no longer have the light that's going to stop the flow because in theory, and I chuckle when you say, yield. Well, yeah, they don't have to stop. We see that at North and Harding right now. And you're coming up off in North and you're heading away from town. It's scary that people don't stop. They yield, they look quick and they go and they decide, can I cut you off or not? Right? And it happens all the time. So yes, in theory, approaching a roundabout is supposed to be slow and is supposed to be safe. But I kind of toss that out the window because we're still dealing with drivers that don't think slow and safe. That's part of why we have this conversation tonight, that people don't adhere to the rules of the road. And again, I'm just throwing the concerns out there. And we're going to end up having to take land that I just don't think we should be having to take when the property owners out of 3 out of 4 of them, that land near their building matters to them. Might not matter to, they're sitting at home watching, they might be like, well, it's great that the select board doesn't matter to them. Well, it does matter to me when some landowner has property that in theory we may not have to take, right? And so I know you're dying to chat, and I'm throwing this out there because I've had people approach me since they've watched 2 meetings where we've talked about it, and they're like, whoa, is anyone looking at why 27 and 109 is working? And and later in the day when it's not super crowded, you can hum down 109, you can hum down 27, and when the lights are the way they are, we don't have many accidents there, right? And in the speed coming down 27 approaching west is a bit concerning to me, and I know that's why people are looking at how can we change it. But I think a dedicated turn lane does change the dynamics dramatically, and I'd be thrilled if we got it done sooner rather than later. But any comments from either of you guys before I go to the microphone?
I think our goal should be to have our traffic engineer talk to the state traffic engineers and come up with the best possible, safest solution for the town. But just taking with you to that meeting, the fact that I'm a strong believer in the roundabout result. Eileen apparently is a strong believer in the traffic signals. I'm not quite sure where Gus is these days, but he was against the roundabout at the outset. It sounds like he might have come around. I saw something about roundabouts at some city in UK maybe 5-10 years ago, and they had intersections in their downtown of a couple of very busy streets, and they took out the traffic signals and put in a series of roundabouts, and the result was that people could cross anywhere in the downtown because everybody was going 10 miles an hour, as you say, because of the roundabouts. And so that they basically improved their downtown dramatically for pedestrians because of the roundabouts that they put in, and apparently the traffic flow improved as well too. So I guess I'm very hopeful that the roundabout would improve the traffic flow over what the signalization gives us right now. It'll certainly, either one's going to make the safety better, but I think the roundabout, because of the traffic calming that you point out, is probably the safer version.
So I'm going to restate what I'm saying here. I'm not opposed if we go forward. Right? I'm absolutely not. I'm not saying stop it now. I see there is a potential for a fatal flaw that we look at by eminent domain. We're going to take land. I'm not a fan of that. I'm just saying as a select board member and as a resident, I don't like the idea of that when there's other options, right? And it's not my property. But if it was my property, I'd be like, whoa, no one's even giving a darn that someone's just going to come along and say, we're going to take this. But by the way, you've got land there where you could put a light in like we have at the center of town. So I'm just throwing that out there. If we go forward, we go to ICE 2, I'm totally fine with that. And if the dialogue can be had with the state, just like I had now, I just want, as someone who's supposed to be representing the town, just make sure you look at some of these things. And if they can go back and say, Eileen, we're not going to impact people coming and going from Aura. We're not going to impact Paul McKechnie. We're not going to force him to shut his entrance down. Or certain things that these are business owners in this town. I don't want it to be known as a town where come in, sign the lease, and then 3 years later, they can mess with you and you don't have access to land you thought you had. Those are things I'm conscious of. But I'm not saying, Pete, I don't want you to say that, like, stop it right now, don't go forward. I've just mentioned, I look at, there is the potential to do the fatal flaw box, the fatal flaw box. I'm not saying we have to do it, but I'm not gonna brush over like, oh, we're not gonna address some of these topics that matter to myself and to other residents that have pulled me aside.
I don't especially like taking people's property by eminent domain. In this instance, those three sides of the intersection are properties that are never going to get developed because of the zoning there. They're just not going to affect what people can build or not build on their property. And it's a fairly minimal amount of taking that would have to be done in any event, I think. So I just don't think that's a very high priority for me, at least.
Well, I'm speaking for, because I know those people have said this to me when you've made those comments, but you're a landowner that has been protective of your backyard. So I'm just speaking for the people that have land, that they're protective of what's going on in theirs. And I just don't want to brush it aside that, Paul McKechnie, I drove by and I'm like, he has got a really tight entrance there. And if we come and push this barrier of having cars, et cetera, closer to his operation, closer to where he come and goes, I don't want to do that.
So I would think that actually, I don't know, you would know better than I can, but by virtue of having the roundabout there, it would slow the traffic in front of Mr. McKechnie's entrance down substantially. So I think it would improve the safety of his egress and ingress to his property dramatically, to have people going 15 miles an hour instead of like they're doing now, maybe upwards of 45.
Can I just do one point of
Yeah, go ahead.
information?
I have no problem. We'll go to
There's
the
a
mic.
lot of easements the town has. A lot of that land actually doesn't belong to those people. Like if you actually look at the drawings, there are lines that Ken's team put on that says where the town, like I think a lot of the land that you're thinking of, the town already owns. So I think that we have to move forward with an open mind for everything to get real drawings. Because I also have driven around to roundabouts in the state too, and not every single roundabout has a crosswalk on every single piece. Not one has a sidewalk on every single piece. And Lord knows we don't put sidewalks in this town anywhere. So what makes us think we're going to put
Mo is
four-
trying. He's standing behind you. He's like, we're
Well,
trying,
you
darn it.
know, like it's unrealistic to think that we're going to put 4 sidewalks and bike paths around the entire thing. But I think that the whole point on this is to get to the next step. And he's asking whether or not we think that either one of those things is a fatal flaw. And I think that if you check off that one of those things is a fatal flaw without, it precludes us from getting all of the right information from everything. And correct me if I'm wrong, it isn't after this process, like there's a public hearing that's going to happen, right?
Yes.
At some point?
Well, from DOT standpoint, they want to make sure that this is a lesson learned on their part. They want to make sure that by the time we get to the 25% public hearing,
Yeah.
that, there's consensus on what the design concept should be, not during the 25% hearing.
Understood. But is that like, so ICE 2 and then is there the public hearing? Like where is that in the process? I guess that's my question.
Well, if we elect to identify no fatal flaw, so we would basically run all the analysis, and DOT will review, and and they would identify the preferred design option.
And then that's what the public hearing is after that one.
No, then we would go into the 25% design.
Mm-hmm.
And then once that is completed, we would have the public hearing.
Okay. Okay, thanks. And I think, oh, sorry. go ahead.
You had mentioned sidewalk and bike
Yeah.
accommodation. I do want to note that DOT would require that when we do any improvements that they're paying for,
Mm-hmm.
that it's designed for all users, vehicle, pedestrian.
Understood. And I guess my
Bike.
question is, does it have to be on all 4 sides or as long as you can get around? Like if there is a corner with an issue, is it possible that the people have to go, go across the street here and then here to get over, or do you have to go around all four is my question. As long as you can get from point A to point B, can you go around three and not?
Human
from a-
nature,
from a-
people are going to go the shortest distance between 2
No, I'm
points,
just
right?
asking
I mean,
from a-
let's,
from
let's,
a-
let's be like, let's
from
make
a
sure we don't
bike
set
lane.
someone up for failure.
I'm
That-
asking about a bike lane sidewalk perspective. That's all I'm asking about.
That's part of the design, you know. we will
Right, so
look
that's part of
into
the
it, right.
discussion. Okay. And then, I mean, the only other thing that I'm gonna say is that if I'm taking real offense to you wanting to get it done fast, because if we wanted to get it done fast, we wouldn't have stuck this in a drawer 2 years ago. And we have to do it safe. And the intersection getting new lights does not stop running red lights. It doesn't. And if the roundabout is what's safer, then don't take it off the table and care more about people than you do about fast.
About what was the last word?
About trying to get this done fast. Like you're sitting there yelling about an intersection
First
wanting to
of all,
get it done
I don't
fast.
believe I was yelling, Sharon. I think I was making a statement that if we want that to be safer, nothing's going to be 100% foolproof, right?
No,
So
but you said you want the fastest option, and you said that's an intersection.
no, I said if
want
we
the
want
safest
if we
one.
want this done faster, so that we just can't walk in and take somebody's land. This is going to get delayed. That's all, and it also may get delayed, and the state may come back and say, you know what, a dedicated turn lane light in this scenario may work. I look at that and I think, okay, fine, then we got the guidance. I just think that I've said it 1,000 times. I don't believe we should be taking people's property. Right now, to your point, I'm going to be looking closer at where these easements are, but when
Yeah, I
we
don't
look
think
at
you've
where
looked
it's
at
going to be pushed out. And I mean, I'm going to throw a silly scenario by you because you're in this and you're passionate about it. So we're looking at the intersection of West and Harding.
Yeah.
If they came back and said a straight line would make sense.
I would love it.
So we
because you
would-
know what, on my property, I know I have an easement because I've got the telephone pole that goes all the way up to the freaking water main break in my driveway right now. Okay, so let's just
No, but I'm saying, so
Why
you're
are we
someone who
doing
has
it?
land that
Yes.
could be impacted. It's like,
because
we
it's
just wouldn't willy-nilly
safer.
do it.
It's safer. If you want the first 6 feet of my property, take it and make it safer. And I'm sorry, but I'm sure a lot of those people do too.
We're going down some rat
Like,
holes here.
you
that
wanted
probably
to
aren't
do this
helpful.
fast. If you wanted to do this fast, you all should have cared about this 2 years ago, and then other people wouldn't have already been hurt. And we need to make this safer. And if you check that box, it is a personal vendetta of somebody to try to get lights. It is not a fatal flaw.
I didn't say I was going to check it. I said I looked at it and said this is what I would look at as considering a fatal flaw. But it's wise for it to move forward so the state can look at it. But I want the state to hear some of the concerns. I want some of the residents to hear some of the concerns. There are two sides to this to think through. And I'm telling you, people pulled me aside at the state hospital, at Brothers, and said, I saw it. Why is people have a right to talk about the light, which is where we'll end up going if we go to the next stage with ICE, which we should, and they come back and we have a town meeting. I hear what you're saying is, don't set us up for failure. If the town really would prefer we go the direction of a dedicated turn light, raise the red flag now, because the state will be frowning upon us later if they bring the roundabout as an option, and then we have a town meeting or the public gathering, and it goes the other way. And
Can I take a crack at we've heard 3 different versions and public comments. I'm going to take a crack at what I think we have agreement on that might be useful to you.
Yeah.
I don't think any one of the 3 of us want to do anything with ICE 2 that precludes either of the options. That's point 1. I think at least 2 of us don't want to do something that will involve the taking of private property, especially on the corner where it looks like some of the designs we saw would have a negative impact on the business. Mm-hmm. So we are very sensitive to just taking property that people own. I guess certainly getting an answer sooner rather than later is nice, but as we discussed before, whatever it costs, my issue is cost at least, whatever it costs, that's a state issue. It's no longer my issue. So that's not a concern at all. As long as we have those 2 options moving forward in ICE 2, as long as the fact that the roundabout option does not mean anyone that we come up with this, once we've said there's no fatal flaw, then it can be any one of those designs and you're gonna have to live with it, which I don't think we'd have to do. As long as that's not some commitment we're making here that would expose us to that kind of a forced action by the state, then I think we know what we need for ICE too. If we want to keep both alive, maybe that means, it sounds like what you said is we don't want to say that the roundabout has a fatal flaw. Because what we're really saying is some of the designs for the roundabout would have a fatal flaw in our mind, not all of them. So we don't want to get rid of that as an option. So I think that means, well, I think what I'm saying is if I understand what you've explained, I think that says we don't say it has a fatal flaw. Is that correct?
Ken, did you want to talk about level of service with those roundabout options?
They're generally better.
Yeah, I don't think we need to at this point. So I think we just, we're ready to, we want to submit ICE 2. They approve ICE 1. So the next step is ICE 2. And it just happens that the first box, has, identified the 2 viable option, which we will list, signal and roundabout. And there's this box where fatal flaw, that is, if there's any concern, I don't know why they use the word fatal flaw. I think that's such a, strong word, but it is what it is. And that we would want to identify it now if the town has any.
Is there a provision to put an assumption? When you answer and says it doesn't have a fatal flaw, can you qualify that by saying this is an assumption that significant private property will not be required for the design we pursue?
I think that's all up to when we get into the final design to minimize the impact to that.
Yeah, so we're in
particular property.
we're in control of making sure that happens.
Yeah, so what I'm hearing,
Yeah, if it fit there right now, I'd be.
so what I'm hearing is, and then correct me if I'm wrong, as we complete the form, is that we will identify the 2 viable option. We're not going to list any fatal flaw because it sounds like the right-of-way impact is something that, the town is willing to work on and, to fine tune where we have to, especially that property that was identified, to shift it around, the roundabout to minimize that impact. And we would submit the form and then DOT will review it without any fatal flaw. And they will let us know which option they would prefer.
Ken, I think that's correct. And I thank you for guiding us to where we needed to get to. So thank you, and good luck in dealing with Mass Dot for us.
One side note for you. Bucharest has roundabouts that have 4 lanes, lights, and policemen at each one of the intersections. They're really kind of, I was going through it a couple times last week, and it's like, this thing's wild. They have everything.
Right, so. Yes, come up here if you don't mind.
Chad Warren, from Wichita. Karen, fantastic job with all the paperwork you did, and give a lot of credit. I'm kind of late in on this. I didn't know any of this was going on. So I just got a couple questions one of you guys can answer for me. My first one was, there was a street audit, 2020, and they gave short-term fixes. Were any of those short-term fixes done?
I can't answer that.
When you say street audit, is it you're talking about DPW's study?
In the audit, it had 8 suggestions of how to make that intersection safer in the short run.
That particular intersection, okay.
Were any of those done?
What study that was?
The 2021 road safety audit.
So the street audit, right? It gave you short-term fixes?
Wasn't one of them the delay in the lighting?
Yeah, I mean, I saw the bike lane.
That one
So you
was
got the
done.
bike lane.
No,
Within the
well,
last
you got
year or
bike lanes,
whatever?
but I thought one of the, I off the top of my head, I don't remember what the 8 were, but I thought one of them had to do with the delay and the light changes.
Yeah, so I mean,
So that was done.
there's like different type of signals, speed signs, lowering the speed limit down to 40.
That wasn't done.
What's that?
That one wasn't done.
No. From what I can tell, most of them weren't done. And these were simple solutions to have made that intersection safer 4 years ago. So I'm trying to figure out why safety is being pushed aside. I mean, so Sharon did fantastic. And in all this stuff, there was, they said it was short-term fixes and cost-effective. All of them, they said would be under 30,000. And for the past 4 years, there's still been accidents there, but there's no safety. But none of those short-term fixes were done. So I'm just wondering why they weren't done.
Considering I came in mid-22, I can't speak to that report because I wasn't a select board member then, but I would like to actually ask the police chief, because I know when she was here, she was going over some of the things that have been done, and then there's things that she's done recently. Well, you threw me in the beginning, so I thought you were saying a street check, all the streets in Medfield, but you're specifically talking about the intersection of West Street and 27.
Yes, I have a big issue with that too, but that's another time. With all the streets and the safety of the streets.
And for, again, I'm not sure of the answer to this. Can we, as a select board, change the rate of
And for our, Chad, Chad, respectfully, for what the issue is we have on the table right now. That's
I don't care.
That's a discussion.
Been a resident for 52 years. I grew up here. I'm fourth generation. I'm going to ask my questions.
Mm-hmm. Yeah.
So they should have been done 4 years ago. Now, is the town liable if somebody gets into an accident and we knew that intersection wasn't safe? Because I know with tort laws, if we know I was a firefighter here in 96. I responded to that intersection back then, and it was horrible. A lot of bad accidents there.
I think the state has recognized that. I think it's one of the worst intersections. Yeah, so that's not a secret to anybody.
Right, but we're talking 20-something years, and it's still the exact same intersection. I mean, I watched the last town meeting, and I was appalled by the answers and how you guys started the talk with the blogs and all this junk. I don't know what to say. I was just very disappointed. I used to come up here, hang out with Pauline Goucher, Mike Sullivan, and just to see you guys doing that was just.
I'm not sure I even.
What?
I'm not sure. I'm not following what you were talking about, Chad.
So last meeting.
Oh, the last meeting. Oh,
last meeting. So you threw it till select board meeting. So.
Yeah, I'm not a numbers guy. I'm not a.
No, that's okay. No, gotcha. No worries.
Yes, well, last meeting, and I don't know if it was addressed. I came in late, but it was.
I addressed
it. Yeah, so I'm guessing that most the short-term fixes weren't done. And there's no reason why they shouldn't have been. So the town kind of dropped the ball in that. I mean, unless you can argue that, I don't know.
Yeah.
Go ahead.
I could just indicate generally that both as to speed signage and light controls, we don't have authority to do it unilaterally. You have to go through DOT and get their approval.
According to the audit, it said all you really needed was an engineering survey, a study or something, to lower the speed limit down 5 miles an
Goes
hour.
the other way too. If they come out and they set that up and your speeds are higher, you can end up with a higher speed because they take an average percentage.
I'm going to assume they're not going to raise that speed up when you're pulling into an intersection.
Don't assume anything with the state.
Madam,
But your points, I have no problem listening to you. I'm actually going to go and look at that document, out of interest, go to Chief Brett and see, is there anything that she's done that I'm not it's not coming right off the top of my tongue here. I came on in 2022, so 2020, 2021, I'm gonna plead, not reading those reports, but Sharon did do a great job summarizing. I myself went in and saw some of the things that the state did recommend, which was a changes light in, I think, 2021. And then it came back, as you were saying earlier, Ken, that the state started to look at roundabouts as solutions. So it's kind of been a moving target. There's been a lot that's been going on in this town. I think there was a school vote that was a little chaotic. There's a Trinity thing going on at the state hospital. There's a lot that goes on in this town, and it would be great if every project that came forward would get us hyper-focus. So if this did not get addressed, all 7, and it turns out only 1 or 2 got addressed, then we can't change the past.
Right, can't, but we can,
Going
going forward, we
forward,
can
yeah,
make that
absolutely.
safer.
Yep. I mean, everything is about moving forward and going. No one's looking to have anybody get hurt. So it is moving forward in the spirit of trying to be safe, right?
Okay. Next question. Gus asked last meeting, what happens if we don't make the date? In 2026, I guess it has to end?
For the federal grant, for the federal
For the
grant.
federal grant?
Actually, it has to be committed. They give you till 2031 to spend it. Mass DOT had a conversation with us on Friday about that.
Did they give it to you in writing? Because what they give you in writing said expended in 2026.
No, it had to be committed in 2026. It had to be
Right.
advertised.
Right.
And then the funds could be expended through 2031.
I would just suggest we get that in writing, as long as what we have in writing says expended.
So Chad, to the point though, being the mercenary, hard-nosed guy that I am, at the point that Ken explained that if Mass DOT approves the project, that federal funds are down there, let's for a second assume they expired in 26. If they approve the project, Mass DOT would still have to figure out how to scrape up the money. I said, not my problem, man, I don't care. I do care, but if it expires, that's not going to influence my thinking because we're not the ones that are holding the bag. That's a little harsher than I really feel, but you see what I'm saying? I wasn't worried about that once I knew it was the state that would have to come through. We would want to not do that, but it's not money that was originally my opposition to the roundabout had to do with the $500,000 more it was going to cost. And before we sign up for $500,000 more on an intersection that presumably could be fixed through lights, I was against the $500,000. At that same meeting, when I thought I was offering a completely absurd idea that if roundabouts are safer, maybe we should make all intersections that have lights in town roundabouts, the response I got was, yes, we should. And it's like, okay, we're going down you do want to do things. I'm more supportive of the roundabout because of what Ken's told me about the flow of traffic on top of everything else. And I like roundabouts.
I just want to, because the way it sounded like it doesn't matter if it goes by 2026.
Apparently, that makes it even better.
Like,
Yeah.
I would get that in writing from everybody. Because if it doesn't happen in writing, it doesn't happen.
Well, if it doesn't happen, it's the state's problem.
Same with the state hospital, with the asbestos and all that stuff. Didn't the state say they were going to help us with that?
No.
No?
No, they helped us by giving
Ah,
us,
sorry.
they let us buy the property at a cheap price.
The tip grant, when you got notified, it said it had to be a certain bit, 3 things had to be done within 2 years. Were they done?
I think I know exactly the letter that you were referring to, and we've reached out to DOT. So basically, once DOT approved the project, which they did, and we have 2 years to make sure that the design move forward, and so I think we have met with them. And they know that we are moving the project forward. So that letter, it doesn't really matter at this point, as long as we're marching forward with the design.
Okay.
And they are, right now it's being programmed for $3.9 million, and that's in the TIP program. It hasn't been funded. They don't know where to get that money from, but that's the amount that they have in the state project listing, and you can check it online. It's right there.
Okay, then I'll skip that question. Eminent domain and the rotaries, Has anybody talked to the business owners?
We talked about that the last meeting, would we go forward with it? And I think the discussion was we wouldn't do it until we got to the point where we had something.
Yeah, it would be premature at this
Right.
point to talk to the abutters because right now, you know, we don't really know which option. It hasn't been finalized or officially, you know, confirmed which
Well, yeah,
option.
I mean,
But
imagine
to
if,
your question, we absolutely need to talk to the business owners before we pull the.
I mean, they might be,
Right.
I mean, I don't know, I don't want to speak for them. They might be psyched. They might be, oh, wait, this is going to make it much safer for us, blah, blah, blah. Well, they might say it blows, it's not good. But if they say, I don't mind, then no point arguing it. We're talking about it.
Well, except the fact it costs the town money, so we don't get it for free.
Right,
So if they
right.
say they want a
Right, right.
particular price, it's unrealistic. It's
Right.
not
But
that
I'm
easy.
just saying, if they're okay with it, then why?
Yeah, they're okay for getting money, I get
But
that.
nobody's talked to them.
Yeah.
Nobody's.
Well, and again, there's a reason
gotten
I
that input.
actually wanted that last meeting. I was like, could we go do that? And I was suggested that we hold off until we have a better vision of what's happening here and how much land we might be asking for and things like that.
So my only other statement is, this started back 2022. There were emails, a whole bunch of emails, and somehow everything got missed. And now we're rushing to come up with a solution to try to fix this. I mean, I think there should be some, almost like acceptance. I mean, the emails were going back and forth, then Jackie
Yeah.
then Jackie and the state were going back and forth trying to get this project moving, and nobody was pushing this along. And there were, last year, there was an email, I believe it was from the DPW to, I'm not sure who, saying we're waiting on the selectmen to decide. So this,
We've never been presented with decisions.
well, there was an email, so I don't know if there's
we don't need
miscommunication.
it. We don't need either.
I mean, you can look at it in the packet. But there should have been, I don't know why we waited to the last minute. It should have been done.
That's what, I have no problem if you have that opinion. There's a lot we do. If you see how much information's in our packet and every other week, there's a lot that goes on in this town. And nothing was done with ill intent. So if you feel that way, I have no problem with that. Because there are people that ask us why certain things haven't happened. Why is Pleasant Street not been addressed yet? There's things that are just happening that either slow us down or our energies get redirected, or things just happen in general that push projects out further than we may want. So we are where we are.
No,
And that's all I can say. We are.
yeah, no, I don't think there was any ill intent on anybody's part. I think it was a failure of the town system somewhere. Because somebody wasn't communicating. I mean, I see you kind of making a face there, Gus, but it happened.
What I'm getting at, Chad, so.
And wait,
We've had the discussions about this intersection for a couple of years. But
so
what
you knew
happened-
it was an issue, but you didn't wait till the last minute?
Stop. In the process of getting it fixed, you have to get it fixed through DOT. You have to work through a DOT project. That's a bureaucratic process. That process has changed over the years from what we would have done when we first thought about an intersection of just making a light or a lane change. The information I think that came back to us was, well, DOT is pushing roundabouts now. It's like, well, all right, what does that mean? And I mean, actually, Ken, you've been helpful in the last month to kind of cut through some of this to where we can get on the table what we want to do and figure out how to make it work. And sure, your all collective efforts certainly push this up higher than it was.
Sharon's.
But, well, no, it's not just Sharon, but she only did all the hard work of putting everything together. My point is that it is not a failure of the state of the town system. It's the town working with the state system. The state system is a bureaucracy. I certainly don't know how DOT works. I kind of take what I get told about how DOT works and say, all right, how do we get done what we want to get done within the DOT? The idea that you say, well, you should have done it faster. It's like, oh, it's not. Wasn't all up to us.
I know you guys got a lot on your plate.
Yeah.
There's a lot, and I don't mean to brush that off.
No, yeah.
This was an issue a year ago when the town knew that the DOT was going to be pushing roundabouts. In those emails, it said the DOT is going to insist
Right,
on roundabouts if you're going to use tip.
right.
So why are we waiting till the last couple of months and now we're,
And that was erroneous information from what we just heard tonight.
So can I do this? I'm not, it's going to appear that I'm cutting you off, but we have a long list of people that are still waiting here to.
oh, I apologize.
No, and so I have no problem with what you've been sharing. It's just we keep going back to the same point, and I do want to move this on so that some of the other folks that are sitting out there have to present. They're waiting for votes to move on, unless there's something you want to say as your closing remarks, and then I really would like to move this topic on.
I just feel the town dropped the ball. I don't think anybody was intent. And I'm starting to take this issue personally. I had a very good friend who died on Causeway Street. Causeway Street's been an issue for years. That intersection's been an issue for years, and nobody's done anything about it. And now, gosh, you're like, well, we just got this information, this and this. This was 2 years ago. So,
Okay.
you guys need to step it up. So, thank you. Sorry, you guys had all this.
No. Listen, that's why the microphone's there. You're a resident of this town. I have no problem with anyone coming up asking questions. You have every right to do that. Thank you. Any more questions for Ken? Are we?
Thank you, Ken.
Yeah, we're good to go.
Thanks, Ken.
Yeah,
Thank you,
you're
Ken.
welcome.
Thanks, Mo.
All right. So discussion items and potential votes. Financial policy update with warrant committee. All right, thank you.
Frank, do you, okay, great. All right, well, for the record, Steve Callahan, of the Warrant Committee, co-chair. And my other co-chair is right here, Bob Sliney. We are going to take you through a very exciting presentation on financial policies. I trust that we did circulate copies. Hopefully you had a chance to look at those. So let's go to the first slide. We look at the financial policies. The first slide is why are we updating it? And I think the first thing we had a lot of new members on our committee. We also know there's other, elected and appointed members of committees in town, and that it'd been a while since the subject to risk of while we have some great policies that we've implemented, they haven't been memorialized in writing, and so we took it on ourselves to sort of update what was there. It was first done in 2018, and there was a minor update in 2022. But most of the existing policy document was done in 2018. And since then, we've implemented, both the town and the warrant committee have implemented a lot of very important disciplines, practices, unofficial policies, and we thought that it was a good time to put them to writing. And so we have, in our town meeting, we've also approved many new articles and priorities and goals, including several new reserves that weren't covered in the existing policies. So, and then lastly, and near and dear to my heart, is our bond rating. This document is very important to the rating agencies. They look at it every time we do a debt offering. And as you know, the higher our rating, the least amount of interest cost we will bear as a town. So it could be the difference between a AA and a AAA rating, if we're disciplined in implementing some of these policies. So, let's go to the next slide. I mentioned they were adopted in 2018. The existing document primarily, I would say like 80% of it deals with capital expenditures, capital budget, capital building maintenance programs, and the municipal building capital stabilization and the capital stabilization funds. They were they were created back then, so it was important to have a policy around them. We made big changes and leaps forward in our adoption of all those policies, and they served the town well. And there were some limited policies on reserves and free cash. Next slide. So what did we do? We took, I didn't bring, do you want a copy or?
No, I realized my Mac is about to die. It
Oh,
hasn't-
okay.
I left my power cord at home.
We looked for changes that we thought were needed. We looked at policies of other towns that were representative of our town. And those included Westwood, Northborough, Holliston, Duxbury, just to name a few. We looked at best practices and tailored them to Medfield's facts and circumstances. And then, we shared them with Town Finance. Town Finance is supportive of these policies. They've reviewed them, and we've taken all of their comments and incorporated them. And then additionally, we provided copies of the draft policy to the chair of both the Capital Budget Committee and the School Committee, and also copies were distributed to the superintendent and the Director of Finance and Operations of the school, Mike LaFrancesca. Then we got together and talked about them as a committee. We dedicated a whole meeting to talking about these policies on September 9th. And now we're here. So we're here with we've given the policies to you. Next slide, I guess. So I thought just some general observations about the policies that the current policies were satisfactory, but again, they were overly focused on capital expenditures, and they seem to be lacking other areas that are just as important, quite honestly, right now for the town. So we decided to do what I would call a major overhaul. So we went from a 6-page policy document to a 26-page document. Most of it has been added. There's added sections. And so there's some cleanup administrative things we did, like changing select men to select board, referencing some regulations, mass state law regulations, and then putting in a review standard of looking at it every 3 years. Next slide. So I want to answer your questions, but I thought I'd just go through some of the policy sections that were added and talk about them. And the first one is in the overall financial policy objective in the introductory section. We've implemented in the last 2 years a new budget process, and so we've put that into the policy document. It seems to be well received, and so it seemed to work well last year. So we're going to put that in the policy document, and that then I think the next one is on the revenue side. There's some discussion about when we budget revenue, how do we approach that, particularly for one-time type revenues. So we always want to be careful that we have a sustainable operating budget, and we don't just let one-time type revenues be absorbed into that operating budget. And so identifying those one-time revenues and separating them out and thinking carefully about how they should be used before letting them go into the operating budget is part of that policy on revenue. And then service charge policy, we added one to have service charges looked at once, every few years, to make sure we don't have lost leaders. I don't know if it's a lost leader, but certainly I don't think it's been looked at for a while. Is like this transfer station stickers. Are we charging enough for that? Given the cost of that operation relative to other towns, that kind of thing. So that's just an example. Then on the warrant committee reserve, that we put in a minimum requirement there. We changed the name of it to the warrant committee reserve to make it simpler because we had so many accounts with reserve in their name. So we called it the warrant committee reserve because it's solely under the direction of the warrant committee. And so we put a minimum in there for a budget requirement. That's 0.2 to 0.3% of the operating budget. We also put we raised the free cash minimum balance, unexpended free cash minimum balance. It was 2.5%. We increased that to 3%. And then on general reserves, the general reserves are primarily, they're made up of three categories now: the warrant committee reserve, the stabilization fund, and free cash. And free cash, I mentioned, is 3%. The general stabilization is 5 to 7. So our general reserve is the all of those, and that's a 8 to 10% requirement. And then for special purpose stabilization funds, we've added a section on the pension reserve and how that account gets used, and the considerations that get thought through in deciding how much of that reserve should be used each year to help offset increases in the pension expense. We also added a goal on the capital. The one fund that we don't have we have a dedicated, as you know, a dedicated revenue source for the municipal building stabilization fund. We don't have one for the capital stabilization fund. And so we thought it was important to have a minimum type of goal there so that we weren't, in case we had an emergency or some type of, urgent need, that there was at least a balance. We didn't spend that down every year, but we carry forward a balance in that fund equal to the average of the prior 3 to 5 years. That's what that one is. And then the two new ones that we added are just what got passed at town meeting, the elementary school tax mitigation fund and the special education reserve fund. And those are just fresh from town meeting. So they just added those in. We consolidated the pension policy and the OPEB policy under one section called post-employment benefits section. We have a new debt policy. We have added a section on debt, and this one, there's two components to it. There's debt in the general fund, and then there's excluded debt. The total of those two, we've put in a range of 10 to 12% is the limitation on that. This is of the revenue of the town, and then we also, I can go through it later, but we did in the score, we created a scorecard, and I'll show it to you later. But there's also a new investment policy that we came up with. And that deals with a lot of the safety, liquidity, and yield concerns that Georgia, is sort of her fiduciary responsibilities require her to follow. And there's some reporting requirements that we added there to inform the warrant committee about balances in all the accounts that she's managing. So there's quite a bit of money that she oversees. And then I guess I go to the next slide. These are just some enhancements on the, we updated the OPEB policy section. That was, if you remember, that was, last year was budgeted at $551,000. And we've had a practice of raising that by 5% a year. Let me see, explain this a little bit. Let me back up a little bit before I talk about OPEB. So our pension obligations, we have this reserve that we're using to offset the required assessments. Norfolk County has been operating under a plan to fully fund that pension. The latest estimate was 2029, although we've heard recently that that may not be a certain date, so it may change. But the latest estimate we're dealing with is 2029. After that, the projections fall off rapidly. So the assessments that the town gets goes from like I think it's like 3.6 million to 500,000. There's like a big pickup in the operating budget in 2030 because we don't, the plan gets fully funded. And so when it came to the OPEB policy, we said, look, rather than increasing that 551 every year, we know that in 2030 or whenever, it's somewhere around that date, when we're fully funded on the pension, we're going to have a lot more room in the operating budget. And then we can fund OPEB out of, right, to date, we've been funding it with free cash. We can put it in the operating budget, have it built into the operating budget, and the operating budget will have no problem absorbing it then because of the fully funded pension will go away assessment. So,
Steve, why would you put a long-term financial liability in the operating? Are you talking about the true operating budget?
yes.
Why?
Well,
Why would you do
I mean, there are other towns that do that. It's because we have a great need for free cash on the capital expenditure side. This would allow us to.
But from my standpoint, this is going right back to where we were 8 years ago, where all of the debt service and everything showed up on the town side. So there was just a town budget and a school budget, and all of the pensions and things like that were in the town budget. And Mike Sullivan was trying to manage. He was controlling a third of the total budget. And when the schools.
Okay. I misunderstood your question. I might have misspoke. When I said it's going to go into, I meant the omnibus town budget.
Okay.
School and town. Okay. It's not. It's OPEB has always been considered a fixed cost of both school and town departments, and that's how we come up with our budget guidance. We take revenues minus fixed costs. And that's how we come up with it. So, it will allow for, we'll have $3 million more when we go through that formula, and 500 of it we're saying we're going to put into the OPEB. So it won't affect one department disproportionately over the other. The way the formula works. Is that? No, it's
Offline, you have to
okay.
explain.
Yeah. So that was the policy on OPEB. We did move many of the capital budget and expenditure. They weren't really, a lot of it wasn't a policy, it was more procedures. So we moved it to an appendix, okay? Kept it all, didn't change it. It's just moved to an appendix, just to organize the document a little bit better. And then we have, we've separated the document into sections so that if there's a policy that we just want to update, We don't have to go through the whole document. We can just edit and replace one section. We'll go to the scorecard. This might be a little hard to read, but these are just, we tried to get on one page what the actual scorecards are of all of these tests that we have, and where we stand with them. And you'll see that the minimum, the warrant committee reserve is set at 0.2 to 0.3. We're at 0.23. The appropriations and transfers into the warrant committee reserve, there's a limit of 5% of the prior year tax levy, and as long as I'm on the warrant committee, I don't think we'll ever get to that level. And then the free cash requirement is at 3%. We're at 2.67, so we're a little shy there, but we have no problem getting to that level. This year, our free cash balance is substantial, and it's not a big amount to get it to 3%. And then the general stabilization fund, 5 to 7 was the requirement. We're at 5.24, and we are looking at putting a little more money into that this year, for town meeting appropriation. So that should continue to grow, get bigger. And then on the general reserve, so when you add up all those reserves, we're slightly over the 8% threshold. But again, we're gonna raise the free cash to 3%. We're gonna add a little more money to the general stabilization, so that will continue to go up, the 8.04. The special education fund, that just has a cap on how big it can get. And so that has 200,000 in it, plenty of room to grow there. And they're taking money from the Medicare reimbursements and putting it into this fund, so it'll grow each year. The non-exempt debt, we've have a policy of less than 0.5%, and we're at 0.37. And so that's the non-exempt debt within the general fund. Most of our debt is exempt, and so that's a range of, when you add in non-exempt and the exempt, it's 10 to 12, and we're at 3.68. That continues to go down as we pay off our debt. Okay. I put in this line here. I called a pro forma estimated. We got a lot of questions on, well, what happens to your test if we build a new school and we borrow money for a new school? So I estimated here, FY27, our total projected debt service, assuming that there was a $5.5 million increase in the debt service for a new school, and as a percentage of the 2027 projected revenue, okay, and that comes to 10.12%. So within that target, the that $5.5 million of debt service was based upon a 450 to 475 enrollment with a 4% interest rate, using and that assumes no MSBA, reimbursement. So I took the worst case, scenario, and so that should be workable. And then the capital stabilization fund is at 862. The average of the last 3 years, it's only been around 3 years, is about $1 million a year, and that should Brent, who's our representative on that committee, thinks that we should have no problem getting to that goal next year or the year after. And then the elementary, the tax mitigation stabilization fund, the goal of getting 4 to 5 million. I know Gus wants to get more than that, but 4 to 5, I think. We're at $1,350,000 as of last year. It was the Hinckley, I think some Hinckley money that's left over, plus 900,000. of free cash we appropriated at last year's town meeting. So, and we're looking at maybe doing an additional appropriation this year with the free cash to build that up even more. So that is, I apologize. There was a lot. I know they're very lengthy documents, probably not the most exciting, but
I think they're exciting, Steve.
I know Frank likes them a lot. But I would be happy to answer any questions or comments you have or anything like that. Bob's here too, if you have anything else.
Pete?
So I just want to thank you guys for doing this. I think that one of the goals that I have for the town is to more formalize the processes by which we do things, and this is perfect. I appreciate you going from 6 pages to 26. And that's a lot of work. I went through it. I have some things. I'll just scan what I
Okay.
did and just send it to you guys. And it's nothing policy stuff. It's just scribbles of questions to myself, but a couple typos and things like that.
Okay,
So-
great.
So Steve, you sent me the draft some time back, and I have not had a chance to go through this in detail. So
Okay.
first up, I have to finish doing it. Unlike Pete, my reaction was, we had a 6-page financial policy that you turned into a 26-page policy. Is that a good or bad thing? And as I was reading it, it was like, well, it feels a little bit like a bad thing, but the reason was my impression, and this is subjective because we haven't had most of this written down over the years that I've been working with the town, is that we have, all informal as it may be, have been sort of guided by a certain set of principles around how we manage our finances, which have been reflected in every policy we've written, more pretty much. Some simple things like you don't use, non-recurring revenue to cover recurring costs. So you've got some of that in here. A basic discipline of let's segregate out the recurring stuff and make sure that that's all balanced. Let's keep the non-recurring stuff and make sure that's balanced. I found myself as I was reading it saying, what I would like when we talk about, let's say, reserve funds, is I would have liked to have had a clear statement of the policy, I'll call it philosophy, but at a policy level. Here are the policies that we apply to the management of our reserve funds. Now, we have right now, if it's important or useful to list those reserve funds so that people know what they are, people know that one of them's not funded by any particular thing right now. For me, trying to follow what was being said, it would have been easier for me to understand what our policies were for funding reserve funds fundamentally, and then can describe those reserve funds, and they'll probably go in and out as we create things. There's one fund, it's one of the funds that I think it might even be the pension reserve fund. It wasn't clear to me whether the policy was here, but I think the policy was suggesting that the pension reserve fund was going to get drawn down, and then the question was, and then is that then going to disappear, or are we going to maintain the reserve fund at some level that gives us the money to provide the annual? And it wasn't clear to me as I read it. I may not have just taken enough time, so I'm partway through this, but I haven't done it all, and I was rushing as it was. But there were a couple places where it was like, gee, do we really need to have a separate policy for each fund, or do we have reserve fund policies about how we manage our reserve funds? And here are the reserve funds that we published. Maybe that's not feasible. I will absolutely defer to your accounting expertise. I'm reading it as the way I read it, and perhaps misunderstanding pieces of it. So I will track you down. I have a lot of stuff. Some of it's editorial, and some of it I was asking myself, if this is a policy, what is the problem the policy is fixing? Because it was like, I don't know why we established this policy. What, as an example, this is one that's genuine. I'm sure it's ignorance on my part. Why do we need to have a limit on the non-exempt debt? Because I assume that we use non-exempt debt first before we start going into debt overrides. That may be just, I think that's a point of ignorance on my part for all.
Yeah,
town
I mean, historically, we have not had a lot of non-exempt debt.
Right.
We used it for, I think, some leases that,
Right.
that falls within the operating budget every year.
But it's also limited by Prop 2.5 already, right?
Yes, it's limited by Prop 2.5, but I mean, there are towns that, that do have a lot higher, policies than we have. So I took what I found at other towns, and most towns, they had separate policies for non-exempt and exempt.
Okay.
Meaning that, they wanted to control how much non-exempt debt, because it takes up part of the operating budget, right? So if you have debt in the operating budget, which is what non-exempt debt is,
Right.
you're taking away from the other needs of the operating budget.
So they deliberately,
Keep it low.
they keep it below what Prop 2.5 would allow.
Yes, yes. As these levels are very low. They're like point two,
That way, yeah.
just to cover what we're doing currently. That's really all it is. And on the pension, there is a, I think if you read it, there's, I'll say there's an attempt to memorialize what the warrant committee has been doing.
Okay.
Okay.
Yeah.
The operative policy that was never committed to writing.
Okay.
And so that's what that is. And it basically says, we have a spreadsheet that we look at, and it looks at what the how much is in the reserve fund, when's the fully funded date, and tries to look at projected assessments from information we get from Norfolk County, however imperfect it is. And we assume a certain investment rate of that money, and that the assessment charges will go up. And then we leave a balance in there. Currently, I silver like around $1 million, so that when we're fully funded, there's $1 million left. Because the question is, well, why do you need a reserve fund if you're fully funded? And if you wait to use it, it's too late, because you can only be used to offset the pension assessment. You can only take money out of this reserve fund to offset the pension assessment. So we're faced with this question of, well, when do we start using it? We can't wait till we're fully funded, because there's nothing to offset it against after that, right? So we have this, so that's what this spreadsheet attempts to do, is it tries to be conservative with information, different data points and information that we get from Norfolk County. And I think it's so far, we've been real conservative on how much we've taken out of it, because we've been uncertain with Norfolk County's estimates. But we're getting to the point where there's a short period of time now between when they think it's going to be fully funded and where we are today. So
Who did you said that you'd gotten some messages from Norfolk County. Does that come from the treasurer?
that's come from
I haven't heard any of this from the
Christine.
Norfolk
No,
County
it
Advisory
comes from the
Board.
Norfolk County Retirement Board.
The retirement board oversees this.
Okay.
And,
Okay.
they have, we've talked about it at our warrant committee meeting. They have oversight by PERIC, the state pension review board.
Yeah, right, yeah.
And they've been always pushing back on some of their discount rates that they've used in their actuarial assumptions, saying,
See how that might be.
and Norfolk County didn't change them. They kept moving ahead. They kept saying we're going to be fully funded by 2029. So we're desperately waiting in the next few weeks to learn what's going to happen with the new assessments. But
I look forward to the next advisory board.
yeah. But we also think that there should be a balance there, because assessments will continue. They just won't be at the levels.
yeah.
There'll always be an assessment for retired people, but the big liability that gets fully funded, once that's taken care of, you'll need something there to cover.
You and I have talked about this even on OPEB, that the way we're doing it, we're funding OPEB, but we're fully covering benefits on pay-as-you-go. So we're both paying out the money under the old system, even as we're putting money into OPEB. And
Yeah.
at some point, whether it might be short of the full funding of OPEB, it's probably prudent to sit there and say, well, do we really need to be kind of doubling the price, or could we actually have some policy that says we're still contributing to OPEB, we're contributing more than we need to, but we're sort of on a glide path to converting over to OPEB as our source of those benefits, and then you start running it like it's just an ongoing thing. I didn't start thinking about that until about a year ago. It's like, gosh, how low do we have to get in our debt, in our long-term liability before we get to start using any of it?
Start using
it
what's in
seems
that
like
trust
you
fund, yeah.
probably could navigate.
I think it's
on it.
around 6 or 7 million now. I can't remember the amount that's in there, but it's,
Yeah, we started at like 44 million. We're somewhere, I haven't seen the latest thing, but it's around 32.
the liability,
33.
yeah.
Yeah.
Yeah, I think
And
that's
part
right.
of that wasn't money we put in. Part of it was playing the game with Gatsby. So all the
Yeah.
discount rates changed and we did the things they wanted done, and all of a sudden they do a calculation different,
Yeah.
which is, that kind of didn't build my resolve to make
Yeah.
sure we followed Gatsby's guidance on how we funded it, that's for sure. Last question I had is just every year we've had, well, every year since probably about 2018, I think when it came up in the town meeting, we've always had maybe this is actually for you, the performance metrics. When we have the budget, we show how we've complied with all of the metrics that were established. Do the metrics here change any of those? It looks like they might expand them a little bit, but did we change any of our goals relative to what we were reporting against up till now?
I think that they've been expanded, is what I would say, and new ones added that weren't there before. Some of the free cash ones changed. I talked about that
Yeah.
one. That's
We had 2.5%.
Yeah, 2.5, so it's 3%.
They're 3% now, yeah. The general reserve ones, the way the policy read previously, the definition of reserve was very broad. It took into account special purpose stabilization funds, which we didn't think was the right spirit of a reserve. That we should just be counting our general stabilization, free cash, and then the warrant committee reserve. That those are another. Between the three, there's $6 million there. And when you look at what's at risk, it's really the local receipts and state aid, which is about $13 million. So 6 million will get you to a 40% reduction in that. Maybe you get a 20% reduction for over 2 years. It would cover you for at least a couple of years, and then you'd have to replenish it. But
And the parameters in those goals, we had this discussion a couple of years ago, at least when we were setting these, whether the standards were applied to the budget numbers as opposed to in operation what you do. In other words, if you said, well, we always will have 3% in free cash, always, then that means you have to have more in free cash in the budget. So if you need to spend free cash,
Right.
you don't get down below. But effectively, when you do that, all you're doing is you're taking the taxes required to fund free cash to the 3% balance and taking it out of circulation because it's an untouchable buffer.
Right.
And so we kind of went through that drill that said, no, these parameters have to apply to what you're planning in your budget. Then in any given year, if you need to tap free cash and go down for something that's come up, you're not going to be at the number that you're targeting. You're going to be at some lower number. You just got to figure out how to replenish it in the next budget cycle.
yeah, well, we have our budgeting process the last 3 years has generated a lot of free cash,
Yeah.
not intentionally.
Well, we'll take it.
So, well, I mean, it crowds out budget requirements, and it's a good problem to have.
Or
Yeah,
it puts too much tax on the
yeah, or
residents.
put our
Because they're-
taxes
yeah.
people too much, but so it's a good problem to have, but not for a long time. You don't want to have that for a long time. I think our policy of having a balance there as a reserve, the 3%, like we've been double that the last couple of years.
Although that's in the context of ARPA funding covering?
It's a lot of different reasons. It's the police department, it's interest rates, it's staffing the police. We budgeted for a full staff on the police. We haven't gotten there till this
State
year.
aid was higher this past year.
State
than
aid was,
anticipated.
it's a amalgamation of a lot of different things. Interest rates was a big part of it too.
Right.
Trying to predict that. So, yeah, we need at least $1.5 million, $2 million of free cash to keep the capital stabilization fund, a free cash that we can use
Right.
above the 3%
Yeah.
for capital stabilization, for OPEB.
Mm-hmm.
We've been fortunate. We've been able to fund some of the school, feasibility studies and some of the tax mitigation fund with what we've generated. So,
Can I ask one last question? Because we
Yeah.
have had this on that, the school mitigation fund,
Yeah.
it's to fund the 3%. What happens to the burden on the taxpayer in year 4? Does it go up, or have we truly?
when you say the fund of 3%, what do you mean by that?
No, I'm sorry. I meant it was intended, the way it's written, it's intended to mitigate the tax
The
impact
tax
of the
impact
debt
of-
for the first 3 years.
Yes.
I'm asking what happens in year 4?
So in year 4, the full impact of the borrowing, there's no offset in the way.
So that's the thing you and I are gonna have to
Yeah.
talk about, because that to me is like, oh, we're gonna make it sound like the cost of the school is here,
Yeah.
and you're gonna buy into it for 3 years.
I mean,
then
the
it's
alternative,
gonna show up
yeah,
and-
the alternative is you could take that balance and reduce the amount of borrowing, but you're talking about a very minor impact
But that's
to the tax bill that
Right.
over 30 years that is that really fair to taxpayers today that are paying the brunt of it right now?
Well, I agree with that.
Yeah.
What
Why not
I'm
give-
getting at is probably the reason I wanted more money was to do that, and then.
But you
fi-
get,
finance
if
the
you
whole
do
thing.
that, if you spread it out over the life of the loan, you end up with like $20, $30. It's not a big impact to taxes.
But if you don't do that and people get hit in the 4, you're still collecting the money from.
Yeah. I mean, the hope is that, that at least that depending on the type of amortization schedule you get, that hopefully we'll get better as time goes on. If we're using a level principal model
If we're
versus
using
level
the
debt.
principal,
Yeah.
right. But, so we'll have to talk more about that.
Yeah.
I'm done.
All right. Yeah, I'm just gonna comment on mine that I want to sit through this and listen and have an understanding as to what you guys were presenting, so I can go back and dig in and now understand why there's some differences, why we went from 6 to 26. Because I think I read through this and I was like, okay, this is very thorough, but I'm not as well versed with what you guys had been doing in the past and some of these changes.
And I think just to add, this document is to the author. I mean, Steve's done a great job putting this work together, and we're really very fortunate.
Absolutely.
It's very impressive.
Absolutely.
I will say that, from my perspective, I can add experience. I've been 7 years on the warrant committee, and when I started, we didn't have.
Do you mind jumping up just to make sure everyone can hear you at home?
When I
Thank
started,
you.
we didn't have this sort of direction. And, you talked about 2018 and the process that commenced, and it started with incremental pieces. And what this does is reflects the budget process that's been incorporated in the last actually 2 or 3 years. The word chaos perhaps wouldn't be too strong a word that some of us went through back in the days of, we're living with deficits and how do we make up the differences and what have you. And if Sharon were still here, she could attest to that, to the spreadsheet management. So we've come a long way. I want to add that as you read this document is not, in stone, but what it does is exactly what Steve and Gus engaged in just now, which is a discussion of clarity on a particular, one of the things that's been incorporated is the 5-year forecast. I will say Frank and Christine have been terrific in being open and in discussions with us. And that's how the process starts. And we start from the 5-year forecast. And then we go into the current year. We talk about the fixed costs. We talk about revenue opportunity. And then we go into, and last year was a big incorporation where we gave direction. Sorry, the word should be guidance, but it's direction to the operating budget for both the school and for the town departments, and gave them the number that we could afford as a town. And that system worked very, very well for all. It brought order to the process. And we didn't end up with discussions in March about who gets what and where this. We didn't start with a reach of, I need this amount, let's see where it lands. We start with, this is what's available, and if you want to get more, then you have to go to the alternative, which is 2.5. So I just want to add to that, it has brought order and memorialized this document. All of us won't be around forever, and I think the process, it's a living document, though, and it can improve, and it will improve, but it does document, and I think it really was illustrated. We have a number of new members of the warrant committee, and it's a great document to give them.
Yeah.
You know,
absolutely.
7 years ago, I got Mike Sullivan's tutorial, and it wasn't quite as detailed in the process as this is. So I encourage you to look at it and give the comments. Your experience and comments are very important.
Perfect.
But it's a great start, I think, and again, full credit to Steve.
All right, thanks, Bob. Thanks, Chief.
No, by all means, we want you to read it and give us comments. And, we are considering it an operative policy at the warrant committee. Okay, but we want to have your endorsement.
So I'll buy the beers next time.
Okay.
All right, go ahead, Chris.
Yeah, Chris Potts, 7 Curve Street. I mean, I think it's the Warren Committee's done an unbelievable job on with this document and overall in terms of just setting, the details and the expectations of what we want to be following with the financials. This is a very common sense suggestion and recommendation is that when you look at the capital, and it's specific to the capital budget, nothing else in the financial policy. But when you look at the capital budget committee charter, and you had mentioned that you have the appendix in terms of procedures. I just think it's important to make sure that the financial policy is consistent with the capital budget committee charter. And I think that, you want to have everything sort of aligning with process. If you look at the charter, it says under the deliverable schedule, the committee shall annually meet with department heads to update the 5-year capital budget for full review by the Board of Selectmen, School Committee, and Warrant Committee. And so there's an expectation there that, this happens with the Select Board, it happens with the Warrant Committee, but there's been a disconnect with the School Committee in that they haven't reviewed they haven't really reviewed a detailed capital budget. They haven't approved recommendations for a capital budget before it goes to the capital budget committee or before it goes to the warrant committee. So it would just be great if the financial policy included school committee in that one section. I think it was page 16, where it says, because right now it says select board receives the proposed capital budget, but it doesn't say that school committee receives the proposed capital budget as well. So that's the only missing gap.
I think you're accurate in that they don't do it before. They have a representative. Mike is actually on the capital budget committee. That's a school committee representative for the capital budget committee, but they don't, as a committee, vote before the capital budget committee does. They get a report once it comes out of the capital, just like you. It comes to you from the capital budget, comes to us from the capital budget committee, and they do get the results of their items that are in the capital budget. They get a report on those. So, but that's I did not go into charters. That's the capital budget committee's purview. But I passed that along to Brent. To take back to the capital budget committee.
I mean, it would be
if
great.
If there's an inconsistency, I'll leave it to them to
Well, in
fix it.
terms of, but in terms of the financial policy, like I said, on that section 16,
Yeah.
I think it's just inserting the word school committee in there next to select board would make sense, because then you're sort of setting the expectation that
Yeah.
that would be one step that you'd want to
Yeah.
make sure it is followed.
Yeah, okay.
And that's
I'll pass that along. I didn't, like I said, I didn't make any changes to that part of the policy. So if there's an inconsistency, it's been there for a while, but that's good. I'll take that back.
Right,
Do you,
thank you.
Eileen, do you have any comments or?
No, my comments were, as I said earlier, that I was coming tonight, since I'm definitely more green than most with this procedure. When I saw how many pages and I knew how short, I'm like, okay, I want to understand kind of the logic, but reading through it, it's incredibly thorough. And to your point, Bob, where you have new warrant committee members, this is kind of their new guidance book, is when you hear all these phrases and why there's these budgets, these reserves, this is a guidance as to why we have them and how they be.
And I would hope that it would also be available to, it is a public document.
Oh, absolutely. So,
Yeah.
Could get members of the town can understand.
absolutely.
Why do we have?
Right.
What is the importance? You know, what is the logic of the development of the budget? Where we have fixed costs, where we have obligations to maintain conservative numbers, not overly conservative, but numbers that will help us in our credit ratings and know how important they are.
Thank you. Yeah.
Okay.
I like the way you move the mic.
Well, hopefully you got some of that.
All right.
Anything else?
No,
Okay,
I think
great.
we're good.
Thank you, Steve.
Thank you.
Thanks very much, guys.
All right, update on the proposed location and construction of the garage at the center at Medfield, and vote to extend the existing contract with Beta for engineering services relating to the project from October 31st, 2024 to December 31st, 2024. Are we doing that tonight?
Yeah.
What's that?
We're doing this, yes. So as we started going through this process with the Council on Aging over the last couple of years, they had originally done some designs on the building, but there had been no civil engineering done on the site. So after talking to the Permit Planning and Building Committee, we engaged Beta to draw out, to do a civil design study to draw out potential locations.
Okay.
The Council on Aging wanted to see multiple locations for the garage. So they have decided they would like location number 4 that you see, and location number 4 brings it closer to the building and closer to where there's a small shed area currently.
So where the white fences, if you were to pull in and look to the left, there's like almost like a little white fence. When you leave from voting and they have you go around the left side of the
Yes,
building.
it comes right
Okay.
there. Yep. For various reasons, they have decided that they think that is the best location for them. I have conferred with the chair of the Permit Planning and Building Committee, who agreed with the Council on Aging. But this now needs to go to the full Permit Planning and Building Committee for their review. This project will require a special permit because the existing property already exceeds the allowable impervious surface, and that will increase that. So we are going to need some waivers and a special permit for the site.
Okay.
And we had engaged Beta through, I think their contract ended ending this month. We need to bring it through the end of the
December
year,
31st, okay.
so they can finish off the design.
Okay. Makes sense.
You need to vote on that? Yep.
Yep, motion.
Okay, move that we extend the existing contract with Beta for engineering services relating to the COA garage project from October 31st, 2024 to December 31st, 2024.
Second?
All those in favor?
Aye.
Aye.
Thank
Excellent.
you. And we'll now take this to the Permit Planning and Building Committee and keep working.
Okay, thank you. All right, discussion and designation of off-leash areas for dogs at Medfield State Hospital. We had this on the agenda the last meeting, but due to me being out with COVID and having it be remote, and Gus, you being out, figured let's do it when all three of us are here. So the intent is right now, we know that the Attorney General approved the bylaw that the town voted on at our annual town meeting. We had it designated that the backfield that rolls into Dover is off leash. We have in the state hospital in particular, the quad is 100% on leash. And then there's been like side discussions, what about across the street and what about the parameter of the property? So I sent Christine a map to clarify my comments from a month ago that kind of outlined the proposed off-leash area, and we'll say coming in at Stonegate. And there's kind of a natural dirt road that goes around the perimeter. And you don't see a lot of dog walkers there other than individual residents. It's something I've kind of honed in on even more in the last month. So to me, it's a natural off-leash because it's usually one-on-one. You're not finding the walkers that are, you're finding walkers, don't get me wrong. But I will say, as I say this, and then because as representing the dog control bylaw committee, I've had some conversations with Jill. I'm going to just give you a little descriptor of what Jill and I have been talking about and then pass off to you guys to have some comments. And then I know I see Frank here and Mark's in the back. So anyone walking their dog coming kind of off the Stonegate entrance, walking up Cottage or up, I'll call the natural dirt road, come up Cottage, you're going to hit the quad. So you either go off to the far left and wrap around the buildings and you're not impacting the quad. But if you go off to the right, Jill has brought this to my attention and I don't take this lightly. When you go up towards what I'll call the tower, which we're calling the tower parking lot in the future, but right now that is a field. And that's the only property that actually abuts a neighborhood. So there is a concern that if someone's coming up with their dog off leash, will it run off to the field? And my comment would be, or my suggestion I should say, would be that we're going to have a map that designates where you can and cannot have your dogs on and off leash. That field, which is a pretty good sized field, the tower field, is absolutely on leash. So if somebody coming in from the neighborhood, their dog's going to be on leash until they get to the property. If they choose to use the dirt road and go around, the dog can be off leash. But if they choose to go towards the center of the property, which is the quad, that would have the owners have the dog on leash. Do you see where I'm coming from? Oh, she has up there. See that just now. I was wondering why you're looking that way the whole
The
time.
center of the property, when you say the center of the property.
The quad.
Quad. When a dog is going up Tower Street, well, so a dog can be off leash coming up Cottage Street. When it gets to, when it's at the end, when it intersects with Tower Street, what
Yeah.
then?
It would be the dirt road can still be off leash, but if you're basically, if you want to be on the grass with your dog, it's going to be on leash. So if they hit the field, that is a on leash mandatory area.
So I would be concerned about enforcement. Given a dog off leash is not going to know it has to stay on a road. So I'd be concerned about enforcement there, but
You can put, so my take on this, it's just relatively small area. We can put signs up, and the big thing's going to be, that's going to be the informational point when people go to the website. So that'll be clearly marked. That is an on-leash area. It'll match the quad area as an on-leash area, and the only off-leash areas will be the far back and exactly the road. And that's what it is. It's a road. So if your dog tends to wander and you go in that area, you're going to be clipping it. And I do know that the animal control officers and the police officers have been up there quite a bit. So the quad is getting significantly less dog traffic because everyone wants their dog off leash. So they're walking to the back. But a lot of people, like I don't take my dog to the field. He's little and I prefer to be on the dirt. So I went up years ago and I picked off 11 ticks in 15 minutes. I realized he can't be on the field. It's like, that's just not going to work for him. So we just tend to stick to the road. And it's like the analogy I used at town meeting. If your dog is acting the way it's supposed to act in an off-leash area, you're not going to draw any attention. If you're in an off-leash area and your dog is running wild, that's not the intent to have your dog running wild. But if there are signs and our town website that talks about where it's leash and off-leash areas is clearly coded, and we can put, there's the signs up there today that give you a map of what the layout of the buildings are. There's no reason why we wouldn't have a map there for dog owners. Here, your designated on and off leash areas. And it seems to be working right now from the quad area because people.
That's fine.
But let me, I've said my piece on kind of why I brought it up a couple of weeks ago. Pete, any comments, questions?
Yes, I think this is a formula for continuing the Medfield State Hospital as a dog park. The dogs aren't going to understand that they have to stay on Stonegate Drive. They're just going to run all over the whole front of the property. Same with all the other streets that are listed here as off off leash areas. I think what you want to do is you want to separate the people who have gone there to walk from the people who want to run their dogs off leash. And my solution for doing that is drawing a line across the back of the property and having the north field as the off-leash area. If you want to be off-leash, go into that field or go into the woods beyond it. But let's give the state hospital property and the roads on the state hospital property back to the residents.
So I think when this came up a couple of weeks ago, the only comment I had, I mean, I'm willing to try something. My issue here isn't where dogs should be allowed off leash and on leash relative to what you're saying here. It's just that having seen the difficulty of enforcing the quad, I can see potential difficulty of having certain sections of the east side near the quad be on leash, other parts off leash, when it was actually hard to keep dogs on leash in the parking area on the north side. But I am willing to defer to whether the animal control officer's enforcement actions are changing behavior. I'm happy to see how that plays out. The only comment I had when I first heard this was had to do with the front lawn. The reason I brought it up is I've never seen dogs fighting on the front lawn, but I have seen people like throwing balls on the front lawn, doing perfectly legitimate things there with their dog, and they're also spread out. It's not that their dogs are running all over the place. They're actually literally playing with their dog. So that was the only reaction I had, is potentially making the front lawn off leash. But I don't do that with my dog. I don't have a view on it. It's just that I've watched people, and the dogs owners that have used the front lawn, I've never seen a problem with that, because they're not going anywhere. They're just got their dog and they're playing with it. So that's the only reaction I had. And I wouldn't fall on my sword on that one either. I just thought that was my observation of how the dogs are being controlled. Or
I find, and I go up there quite a bit, and I tend to use that side of the property. I find that that this is what you find is the one-off. It's the individual man or woman with their dog, maybe casually going for a walk, right? I don't, and I've been asking people a lot over the last month when I'm up there. I'll just stop, and I still will stay. 50% of the people aren't from Medfield, Stover, it's Holliston. They come up, they get their afternoon walk in, but they don't want to be in the field because they don't want to be. If it's a small dog, you don't really want to be along the edges of the woods, right? If you're a pack of dogs, they tend to go to the back. But that's why you tend to see, maybe the mom, the dad, and the stroller, and they're just throwing the dog, the ball in that one little area. I've never seen a pack of dogs there. That's not where they tend to play. So it's kind of like all I'm offering, and I'm looking forward to hear from Dog Control Bylaw Group, is the happy medium where not everybody wants to walk with a pack, right? There's people that just like to go up to a certain point, and then they turn around and go back to their car. So we kind of have, the two halves and the quad in the center. And I will say, Gus and, Gene, I don't know if you've noticed as much, but you don't find as many people walking in the quad now, because when they're up there with their dogs, they're not in the quad anymore. So kind of that has been somewhat solved. Yeah. That like people, if they want their dogs off leash, they know that between Jenny, Mike Downing, and a couple of folks, they are going in there reminding people about the new dog control bylaw. So. But I will pass the baton to Mark, Jill, Frank, anyone, if you have any comments, input. But Bill, obviously.
No, that's okay. No. Mark Farrell, yes, as a member of the dog committee. We haven't discussed this, so my opinion will be just my opinion. And I find this very confusing. Which are the roads, which are the paths. And for people that are out of town, which we know is a lot of the people there, I find this is going to be very difficult to communicate. And I understand, your rationale of wanting a place to walk your dog. But also note that this entire map is where any dog can be on leash. And so anybody's welcome to walk the dog anywhere, in the quad, in out of the quad, as long as it's on leash. One of our goals was to minimize the interactions between off-leash dogs and people with strollers or other people on there who just, are not steady on their feet. So I agree that this would be very difficult to enforce, in my opinion. And I also think that we wouldn't be minimizing those interactions, which was one of the goals. So, I mean, the Northfield, I can't think of a better spot to be off leash. And maybe we need to look at ways to put a path in there, pave it, or, tamp it down, or add to it or something like that, and change that versus, I see this plan as very much like we've had the last 5 years. It doesn't change much. So, and again, we want to separate those off-leash dogs with the people who don't want to be there. We didn't buy this to be a dog park. We bought it for everybody. And yes, there should be places for the dog. And I'm willing to discuss, should the front field be there? Should a different field be there? Should across the field be there? I think that's fine. But I think we need to be very clear with our communications. I hope we'll have good signage, not just the website, as to where it is. It'll be understandable for someone who's never been there before. Again, I've had people tell me from Mansfield and even further away, oh yeah, it's the only place to go off leash in all of Eastern Mass. It's like, but it's really not. So I think we need a lot of education, and I want the education to be simple. And maybe, we can change it back, but to me, this isn't enough of a change from where we are today.
Go ahead, you can go.
Jill Radosta, 36 Long Meadow. My property actually abuts the water tower. So, and as chair of the dog committee, Eileen, you and I have talked offline just a little bit about what some of the concerns were from me as a citizen. And so I do echo the same feeling as Mark feels in terms of this being a little bit more difficult to enforce. And, thinking about someone coming up there, parking, where are we going? You have your dog off leash, on leash. It is very difficult to understand, like, what is on, what is off. And I think with the animal control officer and a couple of the police officers that have been up there, they've actually set a precedence for what is happening with the bylaw. And I feel like it's definitely made an impact on the people that are visiting. And there are a lot of out of town visitors that are coming with 12 dogs that don't even know that it's 5 at this point. So I think just their presence being up there has definitely made an impact on the property. And when we don't want to set the precedence that it is a dog park, I think having the perimeter around those 27 buildings that Trinity is looking to take over, I think this is the now that we need to start to shift it, that it's going to be developed. And so I think this creates a lot of confusion. I do, looking at the outside perimeter. I like the fact that the Northfield and how you said about the green in the front, and over at the hospital, I think that's a little bit clearer. But coming off, pulling up in a parking lot and getting out, and you're gonna have, we really will need some really good signage. But
it would almost be easier, I don't know whether it's a good idea or not, but to basically say the rule is all paved roads require dogs to be on leash.
And that's how it is throughout the town. So I don't want to contradict the bylaw,
The part I'm
right?
talking about isn't paved, like when you go up the dirt, it's a dirt road.
That's
and then
right,
it's
so you
a-
could have the dog off the leash on the dirt road,
But
but
it
as
will
soon as it
eventually-
intersects with the paved road.
And it will eventually be
Yeah, I get you, it
paved.
really isn't paved. That's why the perimeter of the, it's all just broken up gravel dirt. So it's not, the quad is absolutely paved 100%. And then there's sections that, but like when you go up, what's that, Cottage, or no, Stonegate Drive?
Yep.
That's paved, but the ones
Right.
to the right are not, that's
Right.
dirt. Okay,
Right.
so you're saying,
I'm
so,
just
yeah.
trying to keep it a simple rule.
Yeah,
paved,
trying to
it's not
keep
a
it
dog,
and
has to be
simplify it.
you can still go around the campus.
It'll actually extend, there'll be some paved roads on the west side that will be included in that. You can't get to the overlook, well, you can get partway to the overlook, but
It's dirt to the left
yeah,
side.
you're right. Well.
That's the only reason I'm saying, like, we have to be careful how we phrase that, because that's exactly why over the years, to stay out of the quad, to know that that should be on leash, and, even though we finally have teeth to say, yeah, you have to have it. That's been the, You know, you're not engaging with the craziness of the backfield. Yeah, I'll even say from a single female perspective, if I'm up there at 4:30, I don't really want to go in the backfield as a single female to go down there. I'm like, thanks but no thanks. But I think, and I was saying this to a couple of police officers, a lot of this is going to come down to dog owners that are going to be up there and having their dogs running crazy are going to continue to get approached to be, if they can't keep their dog under control, that's a problem. But what I'm talking about is a very large, and Frank, you walk up in the same area I'm talking about. There's a lot of people that are one person, one dog, very simple, very chill, and they're not the reason we are concerned. And it's not the chaos of 5 dogs running in circles all around the center of the quad where people are afraid they're going to get knocked over. You just don't see that when you see the side. It's just not, it's not conducive to that.
But isn't this eventually going to be roadways?
Hopefully,
the
yes.
entrance.
Yeah.
So,
And then it changes. When that becomes the new section of Medfield, then it's a section of Medfield with paved roads. That's public road. It changes everything. But right now, since that's not happening, that's why we have to deal with what we're dealing with. Because that would be the equivalent of walking down Metacomet Street, right? Like your dog's going to be on a leash because you're on a public road. It's not a public road yet up there. It's still in limbo.
I just feel like setting the precedence.
You're gonna change it in 3 years when.
Yeah, why would we wait to do
Well-
that? Why don't we just put it in place
Well, 'cause
now
we,
for
right
the
now
future?
it's not, right? So right now we know Trinity's not up there and things aren't fenced off. So it's, yeah, go ahead, Frank.
You know, that's it? Okay. It's Frank Moran, 19 Partridge Road. I was also a member of the Dog Control Bylaw Committee. I would just say, in a perfect world, if you simply made the Northfield off leash and everyone actually adhered to the leash law, which they're not going to, and we actually enforced it, which we're not going to, and we pushed all those dogs to the Northfield, right? So part of the issue is not only having citizens walk, but it's also minimizing the incidents that we have. The Northfield's already a fiasco relative to the amount of dogs back there. If you push all the dogs that walk around, you know, what you have here, right? People that are 1, 2, 3 walking off leash, if you put all those dogs in the backfield, it's going to be a disaster. Because you're going to go from having 50, 75 dogs to hundreds of dogs back there, which is not a good scenario. You know, relative to this map, I mean, we currently shifted, and again, I'm a dog walker with my wife, so for transparency. But you know, we shifted to try to adhere to the leash law. So you know, luckily they mowed the state property, which is actually right here. So we've been spending time there, but we predominantly walk up Cottage all the way up to the tower and back down. And you're right, there aren't a lot of dog walkers. We happen to be one, and again, we don't want to go in the backfield just because of the activity back there. Communication's been an issue. I mean, it's been an issue from the get-go. So we had a sign up there that said, initially a big, huge electronic sign going into the property. Please go to Medfield website for the updated bylaws. There are no bylaws that are updated, right? We have police officers telling us, even prior to the AG signing off on this, that it was off leash. It was on leash, which it wasn't, it was off leash. I mean, folks that are walking up there really have no idea because there's no communication relative to what's on leash and off leash. So, I mean, I'm a proponent of having more than just the North Field as part of Medfield State property off leash. What that is, I'm somewhat realistic about. Again, I joined the committee from a somewhat utilitarian approach as a citizen of Medfield, not just a dog walker. But the reality of the situation is people just don't adhere to rules. I mean, they just don't. So unless we're going to have 4, 5, or 6 police officers up there 12 hours a day giving tickets out, right? People are not going to adhere to the rules. They just don't. And they still don't. I mean, inside the quad has been on leash since I can remember. And there's 75 to 80% of people that have dogs off leash. They just don't care. So
I have noticed, so it looks like in the last month, people definitely have either decided not to walk in there Or they're walking with the dogs on leash.
And again, we don't walk in there because we have dogs off leash, and you're not supposed to walk in there. So as best we can, we try to adhere to the rules.
Right.
But the rules need to be reasonable. And I understand where people are coming from relative to people wanting, and it's a multi-use property. We run into people walking all the time, baby carriages. I mean, all kinds of people running. I mean, I'm up there 2 to 3 times every day, at least 5 times a week. I mean, I'm spending hours up there. So we hardly ever have issues. And there are a lot of people from Medfield that are walking their dogs up there that want where you're talking about now to remain off leash. Again, it's part of that's a path right to the north field. So if they're going to go in the back field, so they park at Stonegate, they walk up the back gravel road straight by the tower into the back field. So, I mean, you're not going to please all the people all the time relative to this. You're just not going to. So you need to try to minimize the pain as best you can. So, I mean, that's my 2 cents.
That's part of why, in all honesty, that the quad became, it was the sensitive point where people were concerned, like that just wanted to be the safe area. So that was kind of the baby step of, that's got signs up. I know Jenny and others, if they see someone up there with the dog off leash, they're very nicely saying, maybe you're not aware, but it is. And we, I don't know if you guys got the emails that I did with the request of, why don't we just make from like 6 to 8 in the morning, have that off leash? And I'm like, no, that's a formula for disaster, because then the guy at 11 is going to say, oh, I thought it was between 11 and 12. So no means no in that area for certain, right? I'm just throwing out an area that I am up there. I do walk running up there. I don't see that as the problem point. And so if the baby step for now is making sure that the quad, which is a pretty good size area, and it has been where a lot of the dog bites have occurred and all the craziness, because people are content walking in there, socializing in this just utter chaos with the dogs running around. I'll let Bill speak.
Hi, Bill Massaro. I'm the 4th house in the yellow area, a butter. And you've heard me complain before about dogs coming over the wall and everything else and into our yard and everything else. I have graciously decided not to complain about those dogs coming over, and that it is an off-leash area. I understand that. First, I want to thank the committee for all the work that they've done. And I appreciate that as well. It's a controversial subject. They've managed somehow to survive with a very small amount of criticism. I want to point out that whatever you're doing now, it's still another baby step, because once the 71 parking spaces go in there, you're not going to have dogs jumping out of the cars and running off leash in that particular area. And those 71 cars aren't just dog walkers. They're going to be people who are using the Belforge. They're going to be people that live in the buildings that are abutting that area and everything else. So you need to be thinking more about the long-term issue here, which is essentially anything that Trinity bought or where they're parking or everything else, they're not going to tolerate a bunch of dogs running free. I mean, I'll tolerate it in my backyard. The dogs come over, I will complain to the dog owner about the dog coming over, and I will continue to do that. But you should be thinking more about what you're going to need to do with leash once Trinity gets this developed. You're going to have to change it again, I guess is what I'm saying.
I look at this as the whole thing is basically in light number 2 pencil anyways, right? Because to your point, we have this today and we have to deal with what we have today. This isn't going away tomorrow morning. God willing, a year from now, we start to see chain link fences go up, and we've got Trinity in full mode of starting to work in those buildings. And it's a whole different discussion, right?
Well, yes, and you're going to have issues there with the fact that they're going to be remediating buildings. You're going to have, I'm going to argue for air monitors for airborne asbestos around all the areas where people are going to be, walking their dogs or anything else. But again, you need to be concentrating on what's the next step here. I mean, it's going to happen. And you cannot have dogs. I mean, I'm surprised that no dogs have been hit parking at the back of the property right now. When the doors are open, the dogs jump out, they run out, Granted, they're only running maybe 50 or 60 feet to get into the north field, but there's traffic there.
Dogs have been hit.
I think there's 3 dogs that have been killed.
So, all right, so
So
again,
that's why, in theory, people with their dogs are supposed to be keeping them on leash as they get out of the car to go off to the field. And because that kind of abuts the entrance to the quad. But I would say, from what I'm hearing up there and from the communication that our animal control officer and our police officers, they're not getting a lot of resistance. People have been relatively polite when they've been being coached on, you may not be aware, here's the following. But Frank, you're spot on. And it's the one thing that every police officer that I spoke to about it said, yeah, but your website's not helping because there's nothing on there. Right. So we do need to, especially if we're highlighting this, I don't think we've put the map and highlighted even where we are today with on and off leash in terms of the rail trail. And I think we've talked about the back of Wheelock, but even that's coming up to question because of water supply. But I mean, we need to put something because we do have a bylaw and we have the.
Right, and we were waiting for this so that
Okay.
we weren't giving direction and then replacing it with another direction.
Well, we're gonna, I mean, the way I play this is going to be a site that's going to be updated and things are going to change as we go down through the calendar months. But right now, we can at least put a stake in the ground. We know what we asked for at town meeting was clearly the quad and the north field. We knew that coming out of the gate. And then it's been this discussion of what did we really say about the perimeter of the state hospital.
I would suggest that if you need to go back to the Attorney General again, or if you need to go back to town meeting to once you do this, to change again, you best have it thought out when you need to make those decisions, when you need to make the changes, and when you need to get them in.
I think it's up to the discretion of the select board at any given meeting.
Is it
Yeah,
now?
yeah.
So
I
you
mean,
don't
that
need
was
to
the- that
go
was the
back
power
any
that was-
further. All right.
That we say, like, let the three of us decide one way or the other, and as things evolve through town, we're going to have to shift accordingly.
All right, and the other thing, I guess, is as far as the front field goes, I mean, you need to think about, again, your ultimate plans there as well, because that will not, at some point, I'm sure some kind of development will happen there,
Oh, yeah,
especially
yeah,
on Codger Street.
I
and
mean,
everything
Belforge, I
else,
think,
so.
wants to use it when everything starts going under construction
Right.
up there. So, yeah, again, that's why we can shift, but as long as we are getting people to feel comfortable going to the website, or we can at least put updated maps where we have maps on the property today that show the footprint of the property, we could easily put a map next to that says, you know, these are the on and off leash areas. These
So
are the
again,
rules.
I'm not opposed, I'm just saying that, this has got to be only a short-term,
I will say that it seems like the dog trash cans, general trash cans up there, they seem to be being used and they're full. Yep. And you don't see it on the ground as much. I will say the grounds appear to be a lot cleaner.
all right, and I will thank the committee again for all their work.
The only other thing too, with the signage up there, and I was actually looking at it yesterday, so there's a sign right at Stonegate, and I think there are other signs that are outdated. So once we update exactly what this is, we're probably gonna need to replace those signs. Because again, part of this is just confusion. People just
100%.
don't know what the rules are. They know that we changed the bylaws, but they don't know what's on leash, what's off leash. I mean, I had a guy screaming at me last week, me and my wife. It's like, follow the rules, follow the rules. It's like, well, what are the rules, buddy? So, anyway.
All right.
So I have to do a process check here to make sure I know what we're doing as a select board and what you all have done or will do, so I know where we sit. The bylaw review committee came up with a new bylaw and it got accepted, and I think you're still working on potentially revising the bylaw. The new bylaw indicated that the off-leash areas would be specified by the select board. So I'm thinking in this conversation right here, the actionable point is what the three of us think should be the leashed versus unleashed area up at the state hospital, and potentially what we think should be leashed or unleashed elsewhere in town, which probably means Wheelock. And I don't think we're ready to have that conversation.
And the rail trail's a given.
And the rail trail's already, yeah, that's leashed. So, the first part of me around signs and stuff like that, so I'm happy to take recommendations from the bylaw review committee, but from the comments that I've heard from all of you collectively, I don't think the bylaw review committee is of one mind anyway. And perhaps isn't even seeing this as part of your charter, that actually this is really us three. And Eileen, you were recommending what you had described, which was the dirt road. And then Tower Street is back to leash. I just want to make sure I understand what it was you were proposing.
Where is Tower Street? Is that?
Tower Street.
Oh, yeah, okay, yes. So it's basically you're butting the field up there. And it's a pretty good sized field. That's why if this was on our website right now, you would see yellow where you see yellow, if we're deeming that to be my interpretation is that's off leash. Where we see pink right now, literally that pink, that would be just yellow, none of it around it. And then where the quad is, let's just say it's going to be purple, that would be purple, and the field next to the tower, that would be purple. So we're showing people, if you're going to be in those areas, that is where your dog is going to be on leash. And obviously where the parking lot is a given.
So then I think Pete, you had suggested that it should just be the north field is off leash and everything south of that is on leash, and that.
I think that having these streets be off leash is just unworkable. The dogs aren't going to stay in the streets.
Right.
And so, and I agree with Mark's analysis that that this is just not, people aren't going to understand it. And my goal, I guess, is to let the people feel comfortable walking there who aren't going there to walk their dogs off leash. And as Mark pointed out, anybody can be anywhere on the property if their dog is on a leash. I think it makes a very bright line that's easy to understand if the north field is the off-leash area. And that then allows the people that have been driven away from the hospital to come back.
And Eileen, the reason that doesn't make or it doesn't sound like the right answer to you is why?
Because for some people, that's not where they're, so having your dog off leash, if your dog is a dog that is under control, it's not going to run off. And I will speak from my own experience with my own dog. My dog is not taken off. He just follows me, right? That's what there's so many dogs that I walk up there and they just follow their owner. Walking in the backfield at 4:30 in the afternoon, just so I can have my dog off leash, not where I feel safest myself or with a coyote coming out of the woods. So having the ability, if you don't walk up there, it's so hard for me to explain this, but when you are up there, there are one woman and a dog, one guy and a dog, and they're just walking, and their dog is off leash, and they just follow him, and they have their loops that they go around. There are many, many, many dog walkers that's their simple routine, and the dog isn't cutting across the field; it's just following them.
No, I get that, but the issue here is simplicity of rules, because when we changed the bylaw, it was because the bylaw, as it stood, had provisions for dogs under positive control. You're making an argument that some dogs, for some people who only walk on the road, have their dogs on positive control. I don't know how to establish that as a rule. It doesn't create the same problem we had with the old bylaw.
No, I guess what I'm getting at is not all dogs get out of the car at Northfield and just can't wait to go 80 miles an hour. Some dogs just want to go for a walk, and and so the field is not where it's great for them, nor personally as a dog walker who wants to go up and walk with my dog off leash, because it's really good to have dogs off leash. It's very, you don't want every dog to, the moment you get off, you let the leash go, they can't wait to run. I mean, it's very good to train your dog to just go for a walk. But we have a very large piece of property, and it's not saying everything you see. Literally where you see the pink line is 98% of that is dirt. So everyone who claims they want to go up and be safe walking, not the most stable, flat area to walk. But it's nice for people who just want to take one dog and walk around. Other than, I will say, Stonegate is paved, but when you go around the backside along where the dilapidated old garden or whatever that greenhouse was, and you go along the back of where 13 is, that's not all paved. And then when you go along the backside where Jill, and that's not even, that's dirt, that's not being plowed during the winter.
I'm not sure what you're talking about. That's
Oh, I
all
can't-
the stuff on the west is all paved.
You're saying the quad is on leash.
Yeah. Yep.
Everything on the outside of those like 20, well, not 27 buildings, but everything outside of the quad, that perimeter is off leash is what you're proposing with the red. Okay. That's what she's proposing.
As far as gravel, this is the only section right here that's gravel.
It's gravel all the way up to the water tower.
And it's gravel on the backside. They might have tried to have a road back there, but it's not a road anymore.
It's also your main access road to the water tower, too.
Right.
by the way.
Right.
So, I mean, keep that in mind.
I think it's also a misnomer. It's not just, it's just not a dirt road. I mean, there are trees on both sides that are not habitable by a person. So if a dog happens to go, which they do, they run at squirrels in an area which is not habitable by people anyway, which is in the back.
Well,
We're trying to set a precedent that it's not a dog park.
Right.
right.
So I think at this point, this is our opportunity to instill the bylaw and have the dog officer or police up there enforcing it, what they're doing right now on all the streets in Medfield as well. So I find this to be a contradiction of the bylaw in some sense, because there is pavement. They do drive up there. I see the police drive around. I know there are some areas as well, Eileen, because I've walked up there, you know, with my daughter's dogs, but what are we trying to accomplish? And I felt like we, you know, with the charter that we were given, we were trying to designate these certain areas, and that Medfield State Hospital should not be the dog park. We designate areas throughout the town. So if you don't want to walk up there, find another place to walk. You know, we have so many different other areas or other towns to go visit. I just feel like this would be very, like Mark had mentioned, sort of like where we're at right now.
I think it does sound like, Eileen, if I'm just trying to understand what you're proposing, but if it sounds like the part you're proposing on leash is simply the quad.
Yeah.
So that is current state.
And that's what wasn't, because before the bylaw actually got passed, we didn't have the ability to have any of our police officers or animal control officer go up and actually give any violation, because they weren't violating the rule. Now, if they go up there and we have on this map that is 100% on leash, there is no gray area.
But that's the only, what I'm getting at is your proposal is just, that's the only thing that's on.
Well, so when we had this meeting about a month or so ago, and I was trying to describe it, you said, where do you want it? I think that's a pretty narrow piece. I didn't paint everything pink. It's basically the road. It's not saying that the dogs can go run down the buildings across all these areas. Like what I'm hearing you say, which I would have been okay if we didn't do it, is the front part, you're now saying leave that should be yellow. I wouldn't have made that yellow.
That's the front lawn.
Yeah.
Yeah. I'm only doing that because I've seen people, you play with their dogs off leash, throwing a ball and going back and forth. So it's not like the North Field where dogs go romping. It's just that's people use it that way.
And it's kind of like the same balance. I guess all I'm trying to do is the backfield is where you tend to go when you have a lot of dogs, and that's where it gets tagged the dog park. When people, I think Stonegate only fits 7 cars. If 7 people park there and they let their car and they walk, they're just doing a simple loop and coming back. They're not looking for the whole craziness of the backfield. So we're balancing two dynamics of, I'll speak for residents of Medfield. I won't even go to all the out of town residents that come in and they park on that side of the campus, and all they're looking for is a simple walk. It's not craziness. I would support 100% if we did yellow in every piece of that's on either side of the pink line, yellow, excuse me, some other color, whether it's purple or blue. Then we're reinforcing that all the other areas are still deemed on leash, like the center of the quad.
You're creating an unenforceable scenario there. It's the police are going to have no way of figuring out how to enforce the requirements that dogs be on leash or off leash, or, I mean, unless you draw a bright line and just have the north field, that's the only way to make it enforceable by the police. I see Jill nodding, I think, yes.
There's so much contradiction with the property right now, I guess. I'm just trying to make it clear for a citizen going up there or a visitor going up there, and for the police to enforce it. It's like, this is off, this is on, that, like, I don't know.
Well, it's a matter of, I mean, the way I look at it is, if we try it and we actually get a map up there, and we show what can be done, if that's not working, it's super easy to just say, forget it, right? And we move towards no dogs allowed up there, it's a given point. Like we just said, if it's can here, maybe there, maybe it's the point where we decide this is just a really bad spot that we're attracting the wrong type of activity. But if we were right now to take everything that you see on the other side of that pink line and make that match whatever the quad area is going to be, if I'm a police officer and I'm pretty well trained and I'm pretty smart and I'm driving down and I see a pack of dogs on the field near your house, or I see a pack of dogs running on the backside of where where the dilapidated greenhouse is, it's pretty simple to be like, okay, you're violating it. Just if you're in the quad with your dog off leash. If one of the police officers is in the car and we're walking on the pavement and we're side by side, it's pretty that means the dog is off leash and the owner and the dog are adhering to the rules.
I think I agree with Mark that anybody looking at this plan wouldn't understand it and wouldn't come away knowing where they should be and can't be. I think the only way to do it is to draw the bright line and say the north field is the off-leash area. Otherwise, you're not going to be able to enforce it. This is unenforceable.
No, I get, Peter, 100% hear what you're saying, what you're looking at right now. But if you took this map and you put everything on the outer edges of that pink line and just made it purple, you just made it pretty clear that the boundaries for the dogs are to stay mainly along the roads.
No, you're wrong.
I hate that.
Just for argument's sake, if I'm trying to make something in the direction I think you're trying to pull us. It feels to me like we're not making any change at all with where you're trying to pull us because it's the quad. But just for argument's sake, if yellow is off leash and the north field is in yellow, and if the area bounded by Cottage Street, South Street, and Service Road going out to Hospital Road, so it's a little pointy. It's basically the south side of the quad, bounded by South Street on the south side of the quad, and Cottage Street on the east, and Service Road on the west. If that were designated yellow, so the dogs could be off leash effectively on the areas that front Hospital Road, people who want to walk their dog like you're describing, Eileen, could park at the stone gate, could walk that perimeter, and whether they're on leash or not, it wouldn't be a problem because the road is what's actually bounding it. Then everything in the middle is leash, going all the way out to your all houses, all the way to the overlook on the west. That at least might be a more clean designation.
It's cleaner designation, but anybody walking in from the surrounding neighborhoods has to then walk through the off-leash area to get to the hospital. And so they're not going to be, it's not going to get people feel comfortable going back to the hospital as a
off-leash area.
walk.
The dogs that are off-leash on the hospital roadside are not dogs that are roving around looking for victims. They're the ones that people are throwing balls to. That I think partly gets to the issue you had around not necessarily wanting to be on the north field, but wanting to have dogs off leash. Maybe that would work. I'm not advocating, I'm just trying to come up with an option that's not either status quo or just the north field. Let's see if there's anything in the middle, that's all.
That makes sense.
Anybody can walk their dog on leash on the hospital grounds. And so I think that's the solution on the hospital grounds. If you want to walk off leash, go into the north field.
Now, as a practical matter, I think Pete is right once Trinity takes over. Because Trinity owns all the property. My guess is Trinity won't
And why, and
allow
as
the
Bill
front.
says, why don't we just plan for that now? Why do we
And the short answer
confuse
is
it
because Trinity
by
doesn't
having an
have it.
interim step that's different?
At the very least, you should be looking at the temporary access to the backfield that's going to be in place once Trinity starts their work. Because they're gonna put their fencing up, you know, everything else, and you ought to at least look at that area and make sure, you're gonna, because the main road is going to be Cottage Street to the backside.
Yeah, I'm not convinced, Bill, that this becomes the dog walking area once Trinity has developed it.
Well,
Because
no,
it wasn't
totally
beforehand.
different issue. I mean, their 800 residents are not going to be thrilled with all of, they're not going to be thrilled with all of the, however many dogs there are. Now, listen, I was a dog owner. Don't misunderstand me. I mean, we had 2 dogs for 40 years, roughly. All right.
I'm saying I
So-
don't think that was a major dog walking area 10 years ago. Until we bought it, and then suddenly nobody could do anything with it, and then everybody started going there, especially in COVID. and Now it's got a statewide reputation.
But that road is going to become the main road to the back of the property when they're doing their construction work. Cottage Street and up is one of your main access to the parking lot for the parking for the dog walkers, who they'll be parking at the water tower presumably during the day. This is during the construction
During
period.
construction.
So you don't, so there's, I would say it's gonna be the other side of the field, because that's where the overlook is, that's how you get your canoe in, that's access to the Charles. So I would think that they're gonna make sure that side is left open, but the right side could be blocked off, so.
Their temporary parking lot on the left-hand side, right?
On the left-hand side.
On the left-hand side, on the overlook side, on the western side of the property, their temporary parking lot during construction is the laundry parcel.
Yeah.
That ain't gonna happen. There's no parking on the laundry parcel. The majority of your parking, I believe, is gonna wind up on the east side of the property.
Well, I would expect they'd use the east side for a staging area.
Oh, that's not in the plan. They may put it in the plan, but it's not. Take a look at what was filed with the planning board and take a look at the drawings. I'll send you a.
Show temporary parking on the. on
They
the
show,
east?
yes, because that was one of my main comments during the submittal of all of that, is there's no parking on the laundry parcel.
No, so you're saying.
All the parking was
you're
on the other
speculating-
side.
You're speculating that they're gonna put the temporary parking on the east.
I can't see that happening, because then you're asking people to go around that really tight corner where they're gonna be doing construction and going out to 13R. I don't see how
I'll
that's
pull
gonna.
the drawings and send them to you, and you can look at where they're going to have.
Well, we haven't walked the property, actually. We still have not done the final walkthrough that says where are the final boundary lines, because that pinch point going around the South
We
Street.
haven't done the subdivision plan yet.
Yeah,
what
so
they're
that's why
working
that
on
pinch
now.
point is gonna be key to talk about what you're talking about, because if that is as tight as it looks on the drawing right now, that would not work to have people get to the Northfield.
I understand that too.
Okay.
But I'm saying, I mean, the parking is at the right-hand side of the property. In their plans as filed, was it now, 2 years, roughly, a year and a half ago?
Well, I don't think we're gonna make a decision tonight, but, I almost think it would be, I think our next step forward might have to be to actually have a couple of options for this, so, because right now we might be 3 single votes for 3 different things, or.
I'm not opposed to what you just put out. That is, the happy medium is, okay, if you were to just say, and I'm gonna point to the computer, trying to, instead of point, you're talking about this area right here, right? Like this area.
Yep.
So we're saying
Yeah,
all
I
of
don't know if
that
you
is,
can
that
not
can be,
service road.
yeah. I what you said, I think that's a happy medium. You're like, if you don't want to be in the backside, walking by yourself on the dirt later in the afternoon or in the early morning, you're in an area where you're still visible, but you're not, you're not abutting any of the property at that point.
And the issue still is gonna be, is there a way of communicating that, that's as simple as the North Field would be?
Yeah,
Yeah.
there's ways to put, like, if there's a sign right there that gives an overview, when I point, it's the top of Cottage. Or no, top of Stonegate. There's a sign when you get to the top that shows you the buildings. You could easily put a sign right there, right?
And I could see doing something like that. And if we do it and it's a problem, then we change it
Right,
again.
right, right.
And I'm guessing that if it's a problem, we only change it in the direction of more restriction.
Right.
So wouldn't it be better to start with more restriction and just have the Northfield and then see if that's a problem? And then you can always add back places, but I think it's,
I know it's a problem. I can tell you right now, I know that people who walk up there, and if either of you haven't walked up there, I mean, this isn't just Eileen Murphy's opinion. I stop people all the time when I'm, today, can I ask you, I see you're walking down, your dog's not on leash, where do you prefer to walk? There's a group of people that don't go the backside, right? Because they don't want to deal with that. But that's because their dog typically is not the one that's running crazy. They just want a simple walk. So your solution is kind of happy medium. This is not brain surgery. I mean, if you color code it, you put it on the website, you put signs up, and we're not curing cancer here.
our goal is not to satisfy all the dog walkers, unfortunately. Our goal is to satisfy the residents in town.
Well, and
we know that there are plenty of
some of them are residents who have dogs.
Don't go there now because of the dogs. And so you're just going to continue that problem by having the off-leash area in the front as well as the back.
I
Well,
think they're.
I think the dogs that we're talking about that would show up in the front aren't quite the same as the ones in the back.
No.
Yeah. Well, I mean, that would, so if suddenly, that would constitute a problem if we suddenly have a north field and a south field. That would be a problem, and then you'd get rid of it. But to what Eileen's trying to get at, with people just looking for a peaceful walk,
No, and I understand people have to get to the back of the property, and it's nice to be able to walk all the way back there. I just think it ought to be leashed, I guess. That's all I'm saying.
I mean, I would also say this is a way to kind of ease into it. I mean, this has been off leash since I've been walking up there, right? And so all of a sudden say, now it's the only part of it's off leash is in the back. A lot of people walk who we're talking about off leash. So this is at least a transition to communicate what's going to be off leash. And to your point, if it doesn't work, then you know what? Just throw in the towel and kind of go in the back. Plus, there's still discussions relative to other places in Medfield. I know we talked about a variety of things in the committee, and I don't know where phase 2 is going to go, but I mean, this is a potential for a revenue opportunity to kind of
Absolutely.
Mm-hmm.
to self-fund food bags and whatever else, and to actually enforce. Because again, I don't mean to be the eternal pessimist, right? But you can say whatever you want here, but the reality of the situation is, A, people don't listen, and B, regardless of what you're telling me, we don't enforce it, okay? We have never enforced it.
Well, we
So-
have a bylaw that did enforce it. I feel
We
like
had
that's-
signs all over the property saying.
If
off
this
leash.
makes you feel any better, you know this one dog walker that I know pretty well that tends to have her dogs be a little active. She's someone that has now acknowledged she doesn't go in the quad anymore because she knows she's been stopped a couple of times. So she's like, okay, I don't do it anymore. So we are making baby steps. People realize like we don't want the quad to have dogs in there. So people can feel comfortable walking in there, which is kind of what our initial conversation was, which is why those signs went up there first and foremost. Let's make sure we enforce that, right? We can continue to push out that you know, the area we're talking about is manageable. It's visible by the police if they're driving around. But
Well, I'd like to give credit to the police because they are enforcing it and word is getting out.
Yep.
A lot of clients that that I talk to at this point, and the word is out that they're up there, they're visible. People have said what time they're showing up. So, it's baby steps.
and it's only been 2 months because we didn't
Yeah.
find out until the end of August. We really only had September and October.
Yeah.
So
Can you just clarify it? Because I couldn't see what you said. I can't really see it.
What were you talking about
I'll
relative?
jump
if you
on.
start at the if you start
Relative
at the bottom
to-
of the map, the road going up on the right there is Cottage. It
Can you pull
comes
the
to
map
that-
up a little bit? Because now we all know where the Northfield is, so if you can just pull it up a little bit.
There you go.
Yes.
There you go.
No, no, no.
Yeah, that's good. That's good. So people park at Stonegate. They can go up Cottage or they can go up Stonegate. But the boundary I just suggested was go Cottage until it hits Tower and then make that sharp left going back down on South, all the way over to Service Road, then down Service Road to Hospital Road. Make that off leash.
So north and south and
So you'd have a north and south. Yeah.
I mean, obviously, I'm looking at this from a parochial perspective, but I mean, that would certainly, I think, be fair. And I think, again, it's kind of like one of those things where we're kind of progressing. I think it's pretty clear relative to what's on leash, what's off leash.
So if that's clear, at least that answers one of the issues around rules that people can understand.
Right.
If it doesn't work, if Pete's right and that doesn't solve a problem because there's still a problem, then we get rid of it and then we go to just Northfield.
Can I ask just one last question? So the field that's actually to the right, just to clarify, which is actually, I believe, state property, that's out of the scope of the bylaw, correct?
Yeah, we don't own the property.
Okay.
So that's subject to state
State,
rules.
right.
So you can see the line there, that's the town property. A lot of that field is ours.
You mean to the east of Cottage Street, Pete?
To the east of Cottage.
Yeah.
That's our property.
Yeah.
Between the pink and the green. To
It's the straight line it's the straight line, that diagonal straight line that's east of Cottage. Yeah.
There's a stone bound down
But
on
if your
Hospital where that ends up.
If your question was, so if you had a dog off leash on the state property, is anybody going to go after you? The answer is no. Any more than the Bay Circuit, and the Bay Circuit.
Again, when I'm part of the committee, I'm actually going to be looking at it from a Medfield resident.
Right.
Right now, I'm looking at it from a business perspective, so.
There's a comment in the chat.
Oops, sorry.
And so far, Dover has been, I mean, when we do bring our dog, we drive up to the parking lot up north, go straight on Northfield, but we'll cut over to Dover. We'll get all the way over to Smith Lane, Smith Road, and come back. It's beautiful fields over there. And then we'll come down the trails through the woods and stuff like that.
Question, so Deb Barrow, 10 Copperwood, has anyone given thought to the impact upon wildlife and natural resources from influx of dogs? Why is the conversation restricted to what dog walkers want?
I don't think that that's a correct statement. The reason we're having this conversation is trying to figure out how to make it conducive for people that don't necessarily want to walk dogs. So it goes both ways.
Well, I think what you guys are suggesting now is basically a caving in to the dog walkers and letting these people have continue to have the hospital as an off-leash area. And I think it's not going to be enforceable. It's going to be a problem for Jenny and the police. So.
Well, actually,
I don't think we're going to make much progress if this is the result.
We expanded the on-leash area.
You created an enforcement problem.
I think it's pretty straightforward. I think if they drive up and you're in the areas you just talked about, it's either you're in the front part or in the back part, your dog's off leash, you're good. If you're anywhere in the middle.
I'd be happy to revisit it if it's an enforcement problem or if it's a compliance problem. But like I said, we can change it if we need to, but that might be, Pete, I'm not gonna bring my dog to the front lawn. When we bring, on the rare occasion we bring our dog, we usually go toward the end of the afternoon, drive up to the north side. Usually most of the dogs are gone by then and we use the north field. And lately we've been using the rail trail. The dog's been on leash and she's happy to be able to sniff and look for squirrels. So it's not like I don't have a vested interest in how this shakes out. I do use the north field occasionally, but that's all I've really got. I mean, we can walk there from our house, so sometimes we'd walk there, but anything short of that, my rule is if the dog that's approaching us is off leash, I'm inclined to take our dog off leash. And if the dog that's approaching us is on leash, we're inclined to put our dog on leash because it's usually the mismatches is where you get into trouble.
So at this point, do we want to put out for motion, vote, whatever, that we do kind of a pseudo north and south and give that a shot? If we find that the police officers and the animal control officers are challenged with that?
in the interest of not sitting here as a completely inept select board, because I don't think I'm going to be any smarter about this at our next meeting, I'm prepared to support that.
All right.
Pete, I'm guessing won't be, but I will move that we designate the off-leash areas at the state hospital being the north field as designated on the map that we've been looking at, and including an area abutting Hospital Road from the Stone Gate entrance going up Cottage Street to Tower Street, down South Street, which is the boundary of the south side of the quad, and down Service Drive. So inside that is also off-leash, pending learning that that's not a workable solution.
And when we're not showing the fence, so that's actually small, that even looks, that's where the bus is parked, there's an area fenced off, so.
Yeah, that's true.
Okay.
I mean, if they want to go walk their dog off leash in the buses.
All right, so that's the motion on the table,
No second here.
okay? I'll second. All those in favor?
Aye.
Aye, against?
Against.
Okay, here we go.
I'll have to work with Jenny and the police chief to develop signage. My concern is we're gonna develop signage, pay for it all, and then we're gonna change it, so, you know, there's
So I would,
expenses to
I would
change it.
suggest you get Jenny's and the chief's input on this before we do anything, to see whether,
Already been-
because I don't
it's
think
already
this is
been done.
enforceable.
So
I think this is
we
just
get
gonna
their
create
input and have
problems.
another vote to change it if we want to.
I would suggest you get it color coded and online, so
Right.
you
Oh,
just got the two areas shown in color, and that's
So
it.
just when you make those signs, buy a can of purple paint.
Paint the lawn.
All right, so discuss
All right.
and vote to sign mass housing for 86 Plant Street, proposed 40B.
Here I thought
thank you, guys.
here I thought the intersection was going to be the long conversation.
We're on the home stretch if we can get this.
All right. Okay.
Okay.
So. This is the mass housing letter. huh?
Yes.
Yes,
Okay.
so, as you all, attended the, site visit, the select board.
Oh,
has
Pete
the-
did. Only the two of us did. Pete, you didn't walk that.
So Mass Housing has asked the select board, to solicit comments, which they usually do when Mass Housing has a proposed 40B. So Maria has solicited the comments from all the department heads, boards and committees, and she received those all back today. Originally, the letter was needed to be sent this evening. It was going to be due October 15th. They have given an extension on that because the applicant made some revisions to the plan, so we requested an extension so we could review those revisions. At this point, it would be my intention to take the board and committee comments that have been made and put them in a letter from the select board. You're not meeting again before that time. So I don't know if you want to take an opportunity to look at the comments that came in from the department heads, or you're comfortable with me submitting on behalf of the department heads the comments they've made. This is probably the appropriate time if the select board has some comments that they would like to be included in that letter to let me know. The other issue is, no, I lost my train of thought. I'm sorry.
Well, it should be noted that we can't, we did get an email from a resident, but that goes in separately
So
from what.
Kat Miller from Mass Housing has asked any resident who has, would like to comment, they can send their comments directly to, Mass Housing.
Yep.
And I believe Maria has that on the webpage as well.
I'm fine if you summarize the comments and send them
Okay.
in.
Are you summarizing comments or are you sending this in?
No, I'm gonna take it and I'm gonna put it in the format we usually do, where it would be a letter from the select board, and I list every department, and what the comments from those departments would be.
Okay. And our function as a select board is simply forwarding the comments. We're not sitting there passing judgment on the various departments.
You haven't in the past. You have let the department heads speak their concerns about the project directly to Mass Housing.
I don't have any specific comments as a select board member on the project, so I'm comfortable just in forwarding it as an official forwarding from the select board.
Same here.
You good with that, Pete?
I'm sorry.
Yeah, I said I don't have any comments on the project, so I'm comfortable having the select board forward the reformatted comments.
That's what I just said to Christine
Yeah,
before.
so we're fine with that. Yeah.
Would you like me to include a section under the select board comments that you have received communications from residents in the area, and they will be sending their comments separately to acknowledge that you have received comments about that.
Yeah, I mean, I'd like to acknowledge to the state that we did receive a letter from one of the abutters. That would,
And when are we planning to send this in?
It's due on October 30th.
Okay. Okay. So if.
Yeah, so if you
we
think of
spot
anything else in the
something that
meantime
was
or if you see anything-
searingly objectionable, we have some time to.
I'm
tell
not
you.
going to get a chance to even start it till Friday, so you have some time.
So do you need a motion to formalize this?
Okay, I move that we
authorize
authorize the town administrator. Do we need to sign this letter? It says the vote was to vote to sign the letter to Mass Housing.
You can authorize me to
Okay,
sign it on your
okay.
behalf.
I move that we authorize the town administrator to sign the letter to Mass Housing for 86 Plain Street, proposed 40B.
Or I suggest prepare or compile a letter and then sign it on your behalf.
I move that we authorize the town administrator to compile a letter and sign on the select board's behalf a letter to Mass Housing for 86 Plain Street, proposed 40B.
Second.
All those in favor?
Aye.
Aye.
All right, moving on to action items. Vote to authorize the town administrator to sign the town's annual agreement with Cook and Company for $9,500 for health insurance plan management consulting services.
I apologize. I did not get a chance to put this contract together. Mark had one change. This is an annual one that you signed last year. There was one change to the standard form of the contract, and that was to include professional liability.
So do you want us to vote or hold off?
I would love for you to vote because I need to start working on our Medicare enrollment. But if you want to wait till the 14th, that doesn't put me too far behind as well.
Doesn't bother me either way.
Doesn't bother me to do it.
Okay,
I'm happy to, yeah. You okay with that, Pete?
Yes.
Okay, I move that we authorize the town administrator to sign the town's annual agreement with Cook and County and Company for $9,500 for health insurance plan management consulting services.
Second.
All those in favor?
Aye.
All right, vote to approve the request for a one-day beer and wine license for Zulo Gallery on November 2nd, 2024.
I move that we approve the request for a one-day beer and wine license for the Zulo Gallery on November 2nd, 2024.
Second.
All those in favor?
Aye.
Vote to approve request for a one-day beer, wine, and liquor license for the Church of the Advent on October 25th, 2024.
I move that we vote to, that we approve the request for a one-day beer, wine, and liquor license for the Church of the Advent on October 25th, 2024.
Second.
All those in favor?
Aye.
Aye.
All right, Gene. Vote to approve a request for a one-day all alcohol permit for a private caroling event on December 15th at Belforge from 3 p.m. to 6 p.m.
I move that we approve the request for a one-day all alcohol permit for a private caroling event on December 15th at Belforge from 3 p.m. to 6 p.m.
Second.
All those in favor?
Aye.
Aye.
Request from Melissa Cantaro to close Summer Street for trick-or-treating on October 31st, 2024, beginning at 5 p.m.
So I just want to give you a little context on this. This originally came in as a block party permit request,
Okay.
which we forward directly to the chief of police. After reviewing it, she determined it was actually not a block party. They would like to close their street for trick-or-treating. The chief has recommended that that not be approved because we could not accommodate all of the streets in town wanting to close for Halloween.
You actually read my mind on that, because I was like, that's exactly where this could go.
Not only that, but it can introduce a safety hazard because people in town think a street's open and kids think it's closed, and all of a sudden you've got people going down the street. So
Yeah, she had some significant safety concerns about it.
Okay, so.
I share them.
And the chief offered to reach out and talk about sending officers to the neighborhood to do their trunk or treating as well. So she would have some have a discussion with her about that.
So do we?
Just my recommendation would be just decline to approve this request.
Okay. You second the declining it, Pete? Yes?
I think we should decline it.
Okay,
Yeah,
perfect.
okay,
All
so
right.
it's
All
just
those in favor, say
denied.
aye. Okay, declined.
Okay.
All right, town administrator requests the select board appoint a hearing officer for a personnel matter.
So this is we have had several hearings before where you have I have requested you appoint a hearing officer to hear a potential disciplinary or termination hearing. In the past, I've been able to name the officer. I am waiting availability, but I need to schedule this as soon as possible. So I'm asking that you authorize me to choose the hearing officer for this.
Okay.
Yep.
I move that we authorize town administrator to select a hearing officer for a personnel matter.
Second?
All those in favor?
Aye.
Aye.
Aye, aye.
All right. Vote to sign the citations for Sally, how do you say, what'd you say? Kaylee, excuse me, Sheehan and Carrigan Allenby for earning the rank of Eagle Scout. And that is coming up this Sunday afternoon.
Really?
Yeah. I was gonna ask you if you saw that. I didn't find it until last week. But it's.
We didn't know anything about it.
Yeah,
Okay.
so it's this Sunday.
Okay. I move that we sign the citations for Kaylee Sheehan and Kerrigan Allenby for earning the rank of Eagle Scout.
Second?
All right, all those in favor?
Aye.
Aye, aye.
Citizens' comment, none of that tonight. Consent agenda, vote to approve a request from Belforge Arts Center to post sandwich board signs at the Medfield Transfer Station, intersection of North and Main Street, sidewalk jet out, intersection of Route 109 and Hartford Street, northeast corner of Route 27 and South Street, from the dates of October 17th through October 27th to promote end-of-season free events. And then I'll read the next one. Vote to approve the request from Medfield High School Theater Society to post sandwich board signs at the Medfield Transfer Station, intersection of North and Main Street, sidewalk jet-out, northeast corner of Route 27 and South Street to advertise upcoming productions in November and March. But there aren't dates.
Frank's looking.
Do you have the dates?
Just double check. They were looking for a perpetual license.
Can't set that precedent.
I had not heard back on the dates. The musical takes place on November 22nd and March 7th.
It doesn't help.
Yeah.
If you want to authorize us to follow up with them and just confirm that it's the usual locations and our usual time period.
Okay.
Yeah.
We'll
good
follow
with
up
that.
with them.
Okay. I move that we approve the two items on the consent agenda, subject to dates and time periods for the second item concerning Medfield High School's Theater Society being confirmed by the town administrator or assistant town administrator.
Second?
All right, all those in favor?
Aye. Okay.
All right, no meeting minutes, though I did see you send two our way, Frank, so we'll have that on the next agenda. Town administrator updates?
I just have a couple of things. You have the newest version. I actually have a couple of changes to make before I post it online. So if everybody could hold off posting it until I just update a few things. But I just want to call a couple of things to your attention. You have been invited for Friday, October 18th to do the Tri-Valley Vocational School groundbreaking. I don't know if any of you are available, but you are invited. Early voting will start next week. You can go to the website and see all of the dates and times available. The other thing I wanted to talk about was the Medfield Energy Committee. We were just notified today that we were successful in earning a $61,000 window grant to replace several windows at the town hall.
Nice.
So
good.
And a huge thank you to Susan McPhee, Frank, and Ben, who really worked on that project, pulling all the information together. It was quite a lot of information the state wanted on that project. So
nice.
Appreciate all their work on that. And that's it. We'll have this updated and posted tomorrow.
Excellent. All right, we've got our next meeting dates. First of all, before our meeting date, we've got the presidential election on November 5th. Then we have back-to-back November 12th and November 19th. And then our last two meeting dates for the year are December 3rd and December 17th. And then, as listed, there are the dates rolling out for January, February, March, and April next year. Select board reports.
I had office hours this month, the first Friday of every month. I hold office hours at the center from 9 to 10. The Medfield Foundation had a meeting, and we worked mainly, one of the things that we talked about was the Angel Run, which is coming up on December 8th. And at the moment, there's an opportunity for anybody that wants to become a corporate sponsor of the Angel Run. And if you want to become a corporate sponsor, you have to get your sponsorship in by October 31 if you want to appear on the T-shirt. So that's an opportunity for people to get some good publicity in town. Energy Committee met, and what did they do? They always do a ton of stuff. They talked about the DOER grant deadline of November 29 to get some planning money to develop a decarbonization plan. Update on the zero emissions policy that's already come here to this board, but now has to go to the select board for approval. And then the Energy Committee is in charge of the Sustainable Medfield's Action of the Quarter, which is going to be the basically electrify your home, and which is the Medfield Community Electricity, and also the opt-in stretch energy code for. They have a 4-question survey that you can take about the opt-in stretch code. And they're getting ready for an annual town meeting warrant article about that code. I spent some time looking at the 40B down at 86 Plain Street and sharing some input on that. And it's interesting. I've gotten, like in the past month, I've gotten about 300 emails that are all identical from some group that is trying to get us to not adopt generational nicotine ban in town. And they're using technology basically to just, and the emails come from all over the state and the area, not all even Massachusetts. After about 6 of them, I stopped reading them because they're all the same. They're all identical. There are 2 versions, actually. I'm sorry. But it's just interesting that technology is being used to slam us, basically, for something that we're not even thinking about doing.
God
And
bless
that's
junk
it.
folders. Oof.
That must be the copies that I got that I forwarded to Pete's address and said, Gus isn't here, because I've only gotten about 5 of them over the last couple of weeks. So I've been gone on vacation for 2 weeks, had a wonderful time in Europe, great weather. Was humbled at how little I know about Eastern European history, but I know more now than I did before. So it was, anyone ever considering a Danube River cruise, I can now recommend it. And going to Eastern Europe was the first time I've ever been to Eastern Europe, and it was a pretty fascinating cruise. Because Gene Minio is here, I attempted on our first day when we were in Bratislava to find the graffiti that I found on the walls of the buildings a couple times when we were riding the bus up to where we were going in the morning that said, "Make money, not art." And I was going to take a copy of it and say, Gene, I think you need to get out here and fix these people up. They haven't yet recovered from the Soviet bloc, but I couldn't find it. Gene and I both walked up and down the hill 2 times trying to find the building, because I know I saw it from the bus and it was on multiple buildings. And I couldn't find it, but I was thinking of you on our first day there. That's all I get.
Back safe and sound. All right, so I got a couple of things here. So I went to last week, the school building committee meeting that they held at Dale Street for neighbors and residents to come and kind of hear the update. They gave a kind of an overview of where they were with the survey, and it came back more or less. There were roughly, Chris, if I say the numbers wrong, but roughly I think around 1,200 people responded to the survey. Of that, when you look at how the questions were answered, it points to about 96% of the residents are saying Dale should be the location, and now it's really going to come down. The next question is it build new or is it reno add? But all the residents that lived near the property that attended supported the project. So it was a nice meeting. A lot of questions were asked just about the surveys. The way the gentleman that, I think this is what he does for a living, commented, when you get a sample size of 1,200 for a town that has roughly 12,000 residents, and you see that strong a signal, you've got something to work off of. Just a reminder that the Spooktacular is taking place this Saturday in Baxter Park. And then the next day we have the Eagle Court of Honor. It'll be the second female that will have got the honor of being an Eagle Scout. And then I did have a chance at Medfield Day. Denise Garlick had highly recommended I get a chance to sit and meet with Bill Dermody. Had a chance to meet with him, great guy. You'll see a sign in my front yard. I did get an email from a resident that is concerned because he's hearing rumblings about Rose Bay, and I have not heard anything on my end. So I've got to put a phone call in and see if there's any updates, but there's nothing formal. That's what I try to stress to her is, yes, there is a proposal that's been submitted, but nothing's come from the state to tell the town that anything's been approved. And then I've been sitting in a couple of the capital budget meetings, but none this week, right? Okay, I'm good with that. I do have an Affordable Housing Trust meeting Thursday evening. And then last but not least, Christine and I did sit in with Anton, the gentleman that's interested in building a sports complex that he stressed with heavy community element. And this is where I would recommend, when the two of you get a chance to sit and talk with them, kind of push on him when he talks about community element. What does he really mean? What does that play out? How much does that potentially say that he could be doing things to support Parks and Rec, as well as, in the bigger picture to me, other community type of things? Like back in 2007, when we talked about a new Parks and Rec facility, it was rooms that you could do chess and cooking and all sorts of different activities. It wasn't strictly just all sports related. So I look forward to having you guys get a chance to meet with him and his team. Good guy. He said, just to give you some context, they used to live here. They moved to Dover for some particular reasons for one of his children. But he is one of the original investors and founders of Avenue. So he's heavily invested in doing things in the town, and is, just would hope that something can work out, understanding all the hurdles that need to be cleared. Nothing's a slam dunk by any stretch. And other than that, that is all I have. So on that note, motion.
Move that we adjourn.
Second.
All right. All in favor?
Aye.
Aye.